All right, good morning, everyone. It is almost 9 o'clock. We got a tight schedule today, and I'm sure you guys don't want to be here past 6:30. So, just kidding. I'm kidding. Is that coffee or water?
Hot water, my tea.
We're good. Huh? No, I don't. Oh, I think the coffee. I think it's a breakfast. I don't know.
I mean, I'll do.
Good morning, everyone. It is 9 o'clock. I feel so irrelevant.
Do you feel like you're hurting cats?
Yeah. Dogs would listen better.
You need a whistle.
Yes. So I'm going to start going through my slides while you guys are wrapping things up so that we can get started and get out of here on time today. Again, we have a busy schedule. We're going to try to keep our breaks to about 10 minutes today instead of 15. And then if we can try to push lunch a little bit quicker, because I know I've had numerous people come up to me this morning and last night saying, hey, can we get out early tomorrow? And we'll do our best. So anyway, first off, I want to thank our sponsors for today. We have Humana, and I'm looking, we have Joe Urca and we have Anna Benet today. Want to thank Aetna, their crew, Angela, Dan. Let's get a little bit quieter in here. Thank you. Wellcare. Where's Jamie? Jamie's here somewhere. Okay. Molina. We have Jonathan and Javon. Just met Javon this morning. Seems like a nice guy. Looking forward to getting to know him better. I just met him this morning. All right, so Tony and Tabitha, who's speaking this morning? Tony's presenting. So guys, I'm going to have Tony come on up here and get ready to start going this morning. But I also want to make sure today that you guys stop by and see the vendors first thing in the morning. I am sure that some of them will be ducking out. They're not going to stay till 3 o'clock this afternoon. So get to see them before the end of the first break so they have the ability to jet if they need to. Don't forget our pre-ACA kickoff event on the 20th. Make sure you register for that. We have our What's Hot, What's Not on the 27th. And save the date of December 15th for our post AEP party. So we'll have some drinks and food and a time to get together and gather without having to worry about certifications and AHIP and all that stuff there. Lastly, if you guys did not do the QR code and start following us on YouTube, we'll do a raffle at the end of the day today. You do not have to be present to win. Scan the code, start following us on YouTube. We're going to start doing a lot more relevant videos that will be helping you guys grow your business. Yesterday we had fun. We have no more money to hand out today. I lost it all last night. All right. And we have no more parties today. Okay. So thank you to everybody for attending this morning. Tony, why don't you come on up? And just so you guys know, I'm really excited today to find out what the national carriers have for us next year. This year surprised me. We did a lot of business with the national carriers and they keep getting better. The support is amazing with the staff that they have. So let's give a warm welcome to Tony Griffin.
All right, you guys can hear me? I'm going to preface this whole thing with letting you know that currently our plans are being finalized. They've just been, they're still finalizing the rebids. So they're squeezing out that last piece of juice for you guys so you can have better benefits for your clients. The other thing is I'm going to start out today with a little bit of a story. They're kind of jokes. My son's really clever. We have a blended family. So my wife and I met about 10 years ago. We roughly that. And when they first met each other, my son asked my now wife why she drinks coffee every morning. And she responded with, if I don't drink coffee, I get grumpy in the morning. So that night, as we're getting ready for bed, he's like, Dad, can I have juice? I was like, no, buddy, we got to go to bed. He's like, but if I don't have my juice, Dad, I get grumpy. He's quick. So another little story about him. I got him to believe when he lied to me, that his ears would glow red. And this is probably when he was about 3 or 4, something like that. At our old house, we used to have his snacks next to the kitchen, in the kitchen, but next to the sink. And you'd always hear him rummaging through things. Little kids, they're explorers. Well, I found out just by watching him that he would dump his toys. We had them in these little bins, a bigger one and a smaller one, and then he would kind of Lego them together and then climb up on the sink and get into the snacks. Well, I caught him up there one day. I was like, "What are you doing up there?" He's like, I don't know. He's got snacks in his hands. Like, where'd you get those? I don't know. Who gave them to you? I don't know. Are you lying? No. Okay, bud. So we take care of that, and then it continues to happen. But then he gets smarter about it. He doesn't dump his toys anymore. He opens the drawers to climb up, so there's no mess. Well, then I catch him up there. I was like, dude, this is enough. So every time you tell me a lie, your ears glow red. And he's like, no, they don't. I was like, yeah, they do. He's like, no, they don't. I was like, they do. They're doing it right now. He's like, no, they're not. I was like, okay. So I catch him doing it again. I was like, what are you doing? He has snacks in his hand. I was like, where'd you get those? I don't know. Okay, man, well, your ears are glowing red. He's like, no, they're not. I conditioned him to the point where every time he'd come up and talk to me, well, then he got smart about it. So he turned off the lights in the bathroom, went into the mirror, and started lying to him, I don't know what he was saying. I'm glad you, because the end of the story will tell you. I was like, what are you doing? He's like, Dad, that's not true. My ears don't glow red. I started laughing. I was like, well, what do you mean? He's like, that's not true because I don't have a big head. He was in there. He kept saying, I don't have a big head. I don't have a big head. That's what he was saying in the mirror. Okay. So to kick this off, am I supposed to click? Am I clicking it? Yeah. Okay. So this is our Michigan team. Most of you know us. So you're still a director. Tabitha and I are the market managers, or now growth managers. You reach out to any one of us if you have a question. Is that you? Okay. You've seen this a ton of times. Is this not working? Okay. So why UHC? Well, we got a couple reasons here for you. So some of the bigger things here that we're going to focus on is the national network. We have over 1 million providers nationally, which will make things consistent for your members. Some agent tools we'll talk about as well. They are going to benefit you and make things easier and streamline things from the end of the sale to when they actually become a member. So I want you guys to meet Joanna. She's going to go through this process with us step by step. And she's going to show us what the updates are to the member and agent experience. She's smiling right now because, well, first of all, you guys are finishing up the enrollment, and she's happy for you to get out of her house finally. What's going to happen is you're going to ask her, you're going to ask her, how do you want your materials? She's going to say, I want them electronically. So then you're going to put her email in at the end of the app. A couple minutes later, she's going to get this email saying that her application has been received. You'll see that on there. There's a QR code, and it's available on both platforms for the Apple and the Google Play Store, but you can also use the web. As a reminder, well, I haven't told you yet, but when you do the application, you have to use the member ID or the member email that you use in the application, but then you have to use their Medicare ID to log in and track the app. And this is what it's going to look like. You'll notice on the left, it looks a little bit like a pizza tracker. I know a lot of you have seen it on TV. It's pretty similar, but it follows the same process. You can see steps 1 through 5 there. But then on the back, on the other side rather, it lets you know what the plan is, the effective date, the plan premium, and if there's any additionals, if there's dental, vision, over the counter, it lets them know that. The next thing, she's going to get a notification saying, hey, you've been approved. She'll get this. This is the next step. This is letting you know, letting her know anyways, that the U card, if you can read it, has been mailed. This is what she's going to get. Joanna gets this in the mail, and it makes it pretty simple for her. If you look down here, you can scan it with the QR code. You can go online, or you can call the 1-800 number to activate it. You can use the app as well. Let me get a drink real quick. And then boom. Joanna is now welcome to the plan. She gets that as a notification on her app as well. Something new this year. This is going to be new to all of you, and it's going to be really beneficial for those of you that spell in multiple states. This is going to be called the Medicare Product Portal. This will be available to you in Jarvis here shortly. This is where you're going to pull up all of your plans, and you can pull them up nationally. So if you sell here and in Texas, you can save plans and then the sales support teams that will assist you along the way. So that's pretty cool. It's going to help a lot of you that sell in multiple states, again, that you can save all that information. One thing it talked about in there, it showed was the key metrics. So if you want to market someplace new, it's going to show you the eligibles, the footprint, and things like that. So that's something to dive into once you get a little bit farther. This is basically talking about everything that I just mentioned. One thing I didn't mention, though, is it's going to be a single login. You're going to get to it through Jarvis. You're not going to have to log into this or that. It's just going to be on Jarvis. There's going to be a little tile on there for you to get into it. Some other things, you can personalize it, you can customize it, and you can save all that stuff. The biggest thing here, though, is you can customize and save it all to you. So again, if you sell here and in Texas, you can save the support and the plans by that, but also you can customize you can search plans, but also some of the things in here too, the reward earning potential. You can see what that is for your member, and then you can toggle between in and out of network information. If your member has LIS, you can put that information in there, so it'll let them know plan premium if there's going to be one. And then again, this is everything I've talked about already, except this part right here. The dual special needs plans, your DSNPs, that will reflect based on the Medicaid eligibility. And again, everyone will be in there, but it will just be an email. You'll see my shining squishy face in there just the same. And you're like, how do we use this? Where do we get the information? There's going to be QRGs. PhD will have access, so if you want to call, they will be able to walk you through it. There's going to be videos inside Learning Lab, and then you guys will have this available to you in the middle of September. Sorry, excuse me. This is our expansion map. It's the same map that's up there on our little table there. The blues, the dark blue, is where we're currently at with MA. The light blue is our expansion counties. I don't know what color you'd call that, yellow, mustard yellow. My wife would tell me I'm colorblind, but those are where we're at currently with DSNP, and then the expansion counties for DSNP, Lapeer, Midland, and Emmett. This is what it's going to look like when you guys get into the Medicare product portal. This is a screenshot of it. You can compare up to 12 plans. There's 3 of them up here currently. These are all the DSNP. It's only gonna show you though the plan highlights. It's not the summary of benefits. It's not the EOD or the EOC, the evidence of coverage. It's just the plan highlights, and it's gonna go over all the major things. It's gonna let you know the premium, the deductibles, things like that. If there's any ancillary, it'll talk about that there as well. And then it goes into other benefits, the transportation, food, and stuff like that. But it also gives you the service area.
With UnitedHealthCare dental coverage, you get more to smile about, like a $0 copay for covered preventive and most comprehensive dental services up to your plan's annual maximum from our network, including cleanings, fillings, crowns, and more. No annual deductible. Access to Medicare Advantage's largest national dental network. And the freedom to see any dentist. Routine dental care is important to your overall health. A routine dental benefit included in your Medicare Advantage plan can help protect your teeth and gums, and can provide coverage for dental care not covered by original Medicare. For more information or to find a network dentist near you, visit your member site or the UnitedHealthCare app. Show your UnitedHealthCare U-Card to check in for your dental appointments. Your U-Card is your all-in-one member ID card and so much more. It makes it easy to get the most out of your plan, including access to benefits that matter.
All right, dental. This is everything that it just said. A lot of this is going to be a 0 copay to your members, as long as it's preventative, and then some of the comprehensive up to the maximum amount in the plan. QRGs. There's examples of them up there. These are things you can hand out to your members or the dentist, in this case for the dental, their doctors. There are ones for doctors and things that explain other stuff. But these ones, for instance, this one explains how out-of-network coverage works and how it's going to be billed. So if you have questions about it, we have QRGs for it. Again, quick reference guides. This will let you know how to the contact info for the UHC billing personnel and instructions on how to bill it. But also, we have ones for out-of-network providers to submit cost estimates and get clarity about the cost services. There are all of these live inside the toolkit. All of you have access to them now. If you're inside Jarvis. Our PPO networks. Both the MA and the DSNP are both true open PPOs. They're non-differentiated. What does that mean? It means in and out of network costs are the same for primary and specialists. If your primary is not in network, not an issue. While you're writing the app, in the provider section, type the doctor's actual name. And in the PCP number, type non-par probe. All it means is non-participating provider. However, the name of the doctor will not show up on the card. This is an example of what the open PPO explanation flyer is. This is available to you. So if you don't have words for it to explain it, you don't have to. They're right here. This is what you'll look up for, or look it up inside the toolkit. If you guys wanted an explanation of it, it's right there. I'll leave that up just for a second if anybody wants to take a picture. So you have a snowbird. Doesn't matter. We have 1 million providers nationwide. If they leave Michigan, they'll have access to the same non-differentiated copays as if they were using any other provider in our national network. Another QRG here. Again, the quick reference guides. This one right here. You can send these to your doctors, dentists, and things like that. But this one talks about the PPO plans here. But if you have an issue with any of this, this is the escalation form for any enrollment issues, provider issues, billing issues, access to care, anything like that. After you call PhD or member services, you send that over to us and we take care of it. But if they are DSNP, send them into their navigator. The U card.
Using my U-Card at the store is easier than ever with the UnitedHealthCare mobile app. I use the app's product scanner to take the guesswork out of what products I can buy with my U-Card balances. It's a game changer. I just open the UnitedHealthCare app on my phone, click on the View U-Card, then click on the Visit U-Card Hub. Then open Product Scanner. Grab the item I need, line up the scanner over product barcode, and scan it. From sunscreen to vitamins, apples, avocados, and more. It's that easy. Not every product at participating stores can be purchased with my benefit balance, like gift cards. But I can use my earned rewards for an occasional splurge. I do need a new sun hat. Or even toys for Rocky. When I'm done shopping, checking out is worry-free because I know most of the products in my basket can be purchased with my U-Card balances right in the app. Or I can use my actual U-Card. I know I can count on UnitedHealthCare to be there for what matters. Download the UnitedHealthCare app today and get the most out of your U-Card.
So many of you that sell UHC have already seen this, and they should know pretty well, be advanced in all this. But what does it do? It does everything for you. So this houses all the purses. This has everything that they'll take to the doctor, the dentist, anything with rewards, the gym, the utilities, all of that stuff. It's all housed on this card. This little scanner, that's where it all goes to, and it's real time. So it's a smart card essentially. It has access to over 55,000 retail locations in the S3 network. So if your member goes to Walmart, something like that, they have that availability to use that card there. They can also go, oh, sorry, I forgot to put this in here. So this will talk about rewards. They can get a jump start on earning the rewards. If they opt in while they're during the early enrollment process, early in the enrollment rather, if they opt in for the paperless part, they can start earning rewards. They're easy to find and simple to spend. They can spend them on a new hat, new pair of shoes, something like that. Walmart, Kroger, Walgreens, CVS, Rite Aid, those are all ones that are available now. Albertson and Publix, not so much. Mom's Meals, that is for people that are on the DSNP plans. Stores that are coming soon to add to that 55,000 locations, Meijer, Sam's Club, and Save-A-Lot. Instacart and Uber Eats are going to be delivery services that will be available in 2024. So if you're curious what's available, what's not, just if you really think just healthy foods, WIC type things, fresh fruit, fresh veggies, dairy, meat, cheeses, things like that, water, frozen produce, healthy grains, things that are not necessities, things that are not sustainable for life. Booze, but I'd argue that it's pet supplies, sodas, energy drinks, things like that. But this is what they'll get when it's a member welcome booklet. But there's also flyers out there that you can get for the same things that you can hand out if you need to. So if you have questions about the U-cards, again, there are tools out there to let you know. This one right here is really cool. This is inside the app. So if they ever want to know what's available to them and they're unsure, if they have the app, they can scan the product while they're in the store. It'll let them know if it's available to them or not. If you see this right over here, it's kind of tough to see, but it's green. It's letting them know it's available to them. They can scan it, but if the scanner's not working for whatever reason, they can also type in the SKU. So our Renew Active Gym Networks. We have a very, very large gym network of about 25,000 locations nationwide. I know a lot of you have heard about the lifetime thing. There's been emails that have been sent out. It has adjusted your members' times and dates that are allowed. There is a buy-up option. What the cost is, I'm not 100% sure. Transportation.
We're making it easier for our members to get to the care they need by reimagining our transportation service model. Rather than calling the transportation company, members can simply call the number on the back of their card. They'll reach our UHC call center advocates who can arrange the right type of ride based on individual needs. Our call center advocates can provide real-time ride availability and schedule updates and reach out to members if there are changes. This gives our members another touch point with our compassionate advocates who can also address gaps in care or answer questions related to their health plan, providing a seamless one-call member experience. And for members riding with a digitized transportation provider, they'll even receive real-time text messages with driver information and location, making it simple for members to stay informed and feel confident they'll arrive on time. Driven by our partnership with SafeRide, our new transportation service model is already improving ride fulfillment and on-time rates. And when we've surveyed members after their ride, it's clear that we're on the right track. It's one more way we're helping members in moments that matter.
So as you saw in the video, 4.8 out of 5 stars. There's not many people that are getting that kind of love on those Yelp ratings. As you saw, 90% above 90% on the satisfaction for on-time rides and then delivery. Discounts. This is going to be available to your member inside on the webpage there when they get in there, but they have available to them all these discounts. If they want to travel, HelloFresh, they want to do mortgage, insurance. There's a ton of things in there that they have available to them to get discounts on. The Savings Center, this is something that's new this year as well. In the app, they'll have the availability in real time to see all this stuff. And if the plan detects that there's a way for them to save money, it will let them know. So if it's whether switching to generics, transferring to home delivery, so if the prescription is getting mailed to their house as opposed to picking them up, trying a different covered drug, switching your pharmacy may also change things, or the quantity limits. Awesome thing we put in here too is the Medicare supplement. We're gonna have some new things that are coming out for the Medicare supplement this year. Those of you that are coming to our in-person rollouts, Tina will be there to talk a lot more about the dental, hearing, and vision plans that are rolling out this year for our med subs. So just so you guys know, nothing has hush till October 1st. But we also have our rollouts on September 12th and the 14th. Those will virtual. The in-person rollouts, if you've already been registered, it is the 13th. Some important dates to remember. Just getting ready for AEP. Now with that 48-hour rule, I suggest a lot of you setting appointments early on just to get those scopes out of the way. Make an appointment to make an appointment. I would suggest most of you start here, if not before, setting your appointments to get those scopes taken care of for the 2024 selling season. Any questions? Long story short, CMS changed the rules, if you will, and there's a per capita doctor per person. We didn't make the cut. The question was, why aren't we in Macomb? Why isn't UHC in Macomb? Anything else? Going once? No? Well, I've got a question for you. Who wants to watch my kid? No, he's gonna take your stuff. Sonny, where you at?
I don't want to do that. Thank you so much. Ooh, that was really loud. I know we have just a couple seconds before Sunny comes up. And I think, you know what, it accidentally got left out of the slide, but since 5 people asked me the same question, I'll answer it now. Does anybody have any questions about the open PPO nature of the plans in Michigan and how that works with providers being in network and out of network? I just got 5 of them, so I'll answer that. So they are all true open network PPO plans. They are non-differentiated. That means your client is going to pay exactly the same whether they go in network or out of network. If they have a $30 copay for a specialist visit, it doesn't matter if they go in network or out of network. They're going to pay exactly the same. It's non-differentiated in the state of Michigan because it's an LPPO. It's a local PPO. If they leave the state of Michigan, they have to adhere to our national network of over 1 million providers in order for it to continue to be non-differentiated. They can still go out of network once they leave the state, but it's not going to remain non-differentiated. So they might have higher cost share. Does that make sense to everybody? So if you're enrolling a client and you know that they go to Henry Ford Doctors and they're in Wayne County and none of their providers are showing up because they won't, because we're not in network with Henry Ford, it's not a problem because we bill Henry Ford or Henry Ford bills us all day long. I see the bills. We pay Henry Ford bills. Our money is good there. So it's not a problem. So if you're looking for a client, like you're looking for their providers and their providers are not showing up, it does not matter. As long as that provider accepts Medicare and will agree to bill us, it does not matter. If the provider needs education because for some reason they turn the client away, maybe they just don't understand how to bill us, that's when you're going to use those QRGs or you're going to use an escalation form and then send it to us so that we can have provider education reach out to them. It's going to work very similar to the MedSup. If they accept Medicare, they're going to send us a bill. That's it. Any questions about that? You guys can meet us at the table, but I just want to make sure I threw that out there since I had like 5 people all ask me the same thing. Okay. Yes. Thank you. Thank you.
All right, so we're gonna take about a 10 minute break, guys. If you guys want to get up and stretch, get some soda, chips, or something like that, and then what? Still going on, right? Yeah, and we'll get started about 9:50. We are way ahead of schedule. This is good for everybody, but we will have Anna Benet and Joe Urka from Humana starting here at 9:50. All right, guys, 5 more minutes of break, and then we will get started again. We're just a couple minutes away from starting. If everyone can start heading back to their seats. Joe and Anna will be starting to take over. Last person to their seat reimburses me for my tequila bill a couple nights ago. All right, I have 2 quick announcements once everyone gets to their seats. It's getting quieter. All right, so 2 quick announcements. One, we're gonna take a little bit of a longer break after Joe and Anna finish so that you guys can check out your hotel rooms. If you wanna bring your luggage down here, you can, or throw it in your car, whatever works best for you guys. But we'll probably take 15 minutes, maybe 20 if we need it, after the Humana gets done. And then second of all, when we have the speaker up here talking, if you guys could just kind of keep some of the chit chat down. There's a lot of background noise going on when the speaker is presenting, so let's be respectful of the person up here. Joe and Anna? Joe.
Does this work?
and- Nope. Look, we can have microphone wars.
I know. I'm gonna have to hold it way out here. Is this a good volume? A little bit louder? Okay.
Are you guys need a microphone at the same time?
Yeah, we're gonna tag team
Awesome.
this.
All right, here we go. That's right.
Hey, Anna.
Hi. Do you have the clicker? Maybe we have
Completely
someone
unprepared.
doing it manually. All right, slide 2, please.
Maybe Tony's got it. You got the clicker?
Look at UHC stealing the clicker. It's gone. That's okay. Oh, maybe I should open my eyeballs.
Oh my gosh, there we go.
All right. Here's your team in Michigan. I am Anna with Humana. Humana, Anna, whatever. And we have
Joe. I don't have a
Joe.
cool rhyme. And if somebody can help me think of something cool, that'd be great. I don't have anything cool. But yeah, I'm Joe Urca. I'm the senior sales manager. I live in Kalamazoo on the west side, but I now have taken over Metro Detroit. So I'm all over the darn place. So if you see me everywhere else, say hello, Joe. Oh, there we go. Hello, Joe. There we
Oh,
go.
Joe,
Yeah.
that does rhyme.
Hello, Joe and Anna from Humana. All right, there we go.
Also, please note if you're in the Metro Detroit area, Marissa is my counterpart. I live in Grand Rapids, but Marissa resides on the east side of the state, which is helpful. Now I have someone to split the state with, but please take Marissa's information down. You can't miss her. She's about this tall and bright red hair, and she's loud.
She does not need a microphone.
She does not. Just a reminder, please don't talk about what we're about to share with you until October 1st.
Super secret.
Super secret.
It is a website. If you want to check on your phone or follow on your phone, it's very public. Firstlook.humana.com. So if you want to look at the plans or if you haven't, we'll have them up on the screen. But if you want to look them on your phone, you're welcome to do that too.
Yeah. All right, we skipped compliance. I hid all of those slides because it's just a wonderful topic and we want to get right into the good stuff.
Has everybody seen this card?
If you haven't, that means you haven't been selling Humana.
Yes. So green Visa card, I kind of call it the smart card. I don't know if it's that smart, but it does do a very good job of keeping track if because everybody gets this card if you enroll in a Humana plan. Everybody does. If you are in a D-SNP, then the bucket on top turns on, and then you can use it for rent, utilities, pay your cell phone bill, etc. If you are in a what we call just a non-D-SNP plan, then just the over-the-counter allowance bucket is turned on, and you can use it for your over-the-counter allowance and benefit. Anything to add? We good?
What? Yeah. And if there's like one plan with a flex allowance, that amount is loaded on there as well. The nice thing about it is you can just use like the OTC and the top option for dual eligibles retail, right? You don't have to go through Humana Pharmacy anymore. Just a quick note for those that do have a current book of business, don't freak out. You do not have to do anything. This is an automatic process, January 1. The top plan and the bottom plan are what you likely have people in. So that's the zero premium PPO in the top left. It's just going to get assigned a new plan number automatically. You do not have to do anything. Same with your dual eligibles outside of the Detroit area. If they're on the PPO D-SNP, it's going to get a new plan number. That's all you need to really know from this slide. You do
So-
not have to touch it.
Yeah, so member will just get a new card in the mail. I mean, they don't even know what contract number they have. New card in the mail. You do not need to re-enroll anybody. They'll get a new card in the mail. If they're on the 004, they'll go to the 384. So that's what you need to know. There's no call to action on your part other than letting your member know they're going to get a new card. Because as we all know, some members have the same card from 10 years ago, and that's not going to work moving forward in 2024 because they'll have a new contract number.
All right, let's jump in. Who here sells in this like greater Metro Detroit, moving into Ingham, close to Lansing, maybe Genesee, close to Flint? Anybody? Got a couple. Okay. This is the existing HMO that we have. It is a zero premium HMO. We added 2 additional counties. Not a ton of changes because we invested in this plan pretty heavily last year and it sold very well. Just remember that our HMO is a national HMO. So if you do have people that travel and maybe go to Florida for the winter, they can still see their providers in Florida as long as that provider is in our national HMO network. It works just like that in Florida. This is the one and only plan that has that flex amount. You'll see under the extra key benefits, 500 flex card. So that green Visa debit card is going to be loaded with two amounts. Their OTC, which does not roll over. People ask me that. And then the annual flex of 500 used towards dental, vision, and hearing. So they can use that $500 towards their hearing aid copay if they want, for example.
I would say that even though it does have the flex, which is $500, the biggest problem we have in 24 is that members are going to their dentist and showing that green Visa card like it's their insurance card. They need to show their Humana card, and then they would use their green Visa to pay for anything in addition to what their plan doesn't cover. So we got a lot of questions from customer service this year because they're showing their flex card. We just need to make sure we're doing a good job educating member that if you go to the dentist, show your Humana medical card, and then show your Visa card to pay for any of the services.
All right, so if you still sell in this area, you have a PPO option too in the Tri-County area. Everyone else, don't worry, you have a plan for yourselves as well. But if you're in the Tri-County area, you also have a PPO. We did something pretty cool on this PPO this year, though, you guys. We added a $15 a month Part B give back to this plan. I know it doesn't seem like a lot, but at the same time, I think this really boosts I feel like it makes it a lot more attractive. We dropped the MOOP, we removed the RX deductible, and we added dentures to the dental. So that is new for our plans this year. So if you're in that Tri-County area, you have the HMO we just went over or this PPO option as far as like street plans, non-SNP plans. Everyone else, here's the cousin to it. This is that one, 0 premium PPO. It's getting the new plan number. We didn't make a lot of enhancements other than we changed the dental coinsurance and we removed it. So there's no more coinsurance on it. Again, remember all of Humana's PPO plans are an open network nationwide. So you can go to any provider in any state as long as they will bill Humana. It's paid at in-network cost share, everyone. Mayo Clinic, for example, is actually in network with us. So you don't even have to worry about a billing, whether they'll bill or not, because they're in network with us.
I'd like to chime in real quick. So just make sure we remember that the 004 is going to the 384. The other change that I would say, if anybody on this particular plan, is we actually changed tier 2. It's $0 in 2023. It's $5 in 2024. So it went up. We need to make sure we're educating members if they're going to roll over on this plan, because if they go and get a tier 2 med at Walmart or Walgreens or Rite Aid, they're going to have a cost share now. So we need to make sure we educate them on that, and then also use that opportunity to say, hey, we do have our own in-house pharmacy called Centerwell, tier 1, tier 2, 90 days at $0. So if they want to continue to receive a tier 2 at $0, they need to enroll with Centerwell Pharmacy.
I forgot to make it pink. I tried to make all the and Joe's colorblind and can't actually even differentiate between the two colors. So I should have thought about that. Sorry, Joe. Who sold the 102 give back plan last year? Okay, a couple people. We had a ton of call centers sell this, but it is statewide. You don't have to worry about where you live. It is a PPO, so you get that open network. But we did some enhancements this year. It's still 102 Part B give back, but right now the deductible is $675. We're dropping the deductible to $525. And then below it, I highlighted it in yellow because I couldn't fit everything, but we pulled several services out of the deductible. Right now, when someone goes to their PCP or their specialist, they have to meet that medical deductible first, right? Before these copays kick in. Not anymore in 2024. So if you have a healthy person that only sees the PCP probably twice a year and maybe sees a specialist, they don't even have to tap into that deductible. They stay outside of it and they still get that Part B give back. Also, if you look at the RX,
That deductible is 3, 4, and 5. So again, a healthy person, probably if they have any meds, would be a potential tier 1 or tier 2. They're not even going to tap into that deductible. Those are the main changes this year, which I think this makes it a very attractive plan. But again, you have to remember that there is a bit of risk there when you're looking at a medical and an RX deductible, right? But in exchange, you get a pretty healthy Part B give back.
If you haven't positioned this plan when you're selling, one of the ways that I would do this, I think most of us own like a GTL or an ancillary type product. That's how I would position this. If you're saving somebody $102 a month in Part B, you're freeing up $102 a month to buy something else.
Yep.
Again, the more products you have with a particular member, the more likely they are to stay with you, right? So this plan could really attract some stickiness in your book of business.
All right, our
Yeah.
veteran specialist.
Yeah, I'll
go
take
for
over
it.
the veteran plan. So Humana's done some really good work in the veteran space. We kind of were the first of the game, and we work primarily with 3 national sponsors. So we've been with the VFW and AMVET since 2012. We've been a partner with them, and then in 2020 we partnered with the DAV. We do some really cool things like sponsor Rolling Thunder. I don't know if anybody's ever heard of that. They roll through DC. Pretty cool deal. Humana is a big player in that space. And then in this year in 2024, all of our honor plans are going to be USA recommended. I don't know if anybody's ever seen the USAA, right? Those commercials whenever you watch, sports or something. So first year, 2024, USA plans will be recommended. Do you have yeah, go ahead.
Oh, sorry.
Yeah, so we all should be semi-familiar with this plan if you're in the veteran space. This is our MA only plan. The 2 years ago it was a $50 give back. In 2023, it's a $75 give back. 2024, it's a $100 give back. So we're moving in the right direction for this particular plan as far as a give back. That's what veterans want. They want to make sure that if they can't afford their Part B, this is a way to offset that. And we're continuing to move in the right direction there. We didn't make a ton of investment. It's pretty much status quo from 2023, except for that give back there. I would say the other, I don't know, individual that I would put in this particular plan, we've all ran into people that maybe never signed up for a Part D, and then they have a screaming high Part D deductible. Again, you don't have to be a veteran to be on any of our veterans plans. So if any particular person has a really, really high, maybe Part D penalty, this might be a good home for them because then they don't have to worry about that. They can pay their Part D out of their own pocket.
I think another selling point on this one really is with a veteran, they really don't ever have to use the medical portion or anything, but if they end up having to, right? If they end up having to go to the hospital for an emergency or want to seek a second opinion, you have that nationwide open network, right? So they can tap into that at any point should they want to or need to. And I mean, with 125 a quarter on that Visa debit card, plus the Silver Sneakers gym membership and Go 365, which if you're like, what is that? It's just a way to get more gift cards to retailers. I mean, that's just, they can just even use just the bottom portion. It costs them nothing in premium. They get their Part B reduced drastically. You get that open network and all this extra stuff. I feel like it's a nice win-win situation.
And then the other USA plan is an MAPD plan. So this plan does have the prescription drug portion. This plan was available in like maybe 10 counties in 2023, is available 10 or 12 counties
Currently.
in 2023 currently. We expanded it in 2024 statewide. So it gives another option for, again, you don't have to be a veteran, but with a $70 give back, just another way to think about, after doing a very good needs analysis, who would be a good potential candidate for this plan. It does have a higher maximum out of pocket, as you can see at $88.50. But again, you're getting $70 back in a give back. The inpatient hospital, some people kind of balk at that $425, but it stays 1 through 5. The other plans was 1 through 6, 1 through 7. So after you do the kind of the math and you max that out, it's pretty much the same there. A lot of our people are positioning this. Yeah, I'll get to you one second. A lot of people are positioning this one for maybe the spouse of a veteran, because veterans can maybe use the VA for their pharmacy care. A lot of times, maybe a spouse might be a good candidate for that. Yeah, quick question. No, okay. I miss anything?
No, I think sometimes it can feel confusing because we're just running through plan after plan, but I like to think of it as a continuum, like from, the zero premium PPO plan as kind of the least risky, right? I guess. Then this one would be kind of in the middle. And then the 102 that I just went over would be kind of on this end of the continuum, right? Because this one doesn't have a medical deductible, but you also don't get as high of a Part B give back. So there's a trade-off there. So this one kind of sits in the middle. It's like A, B, or C.
You want to do decent? Go ahead.
Sure. I can do a little bit of it and you can help because I forget things sometimes on this. Who here has used Vantage? Who loves Vantage? Okay, because that's what I hear. I don't know because I don't sit in your shoes, but I hear often that Humana has the easiest agent portal. And I'm like, awesome, that's great. Right down the center, if you haven't used this tool, please start because it's awesome. You just click eligibility verification and you type in their information at the top and it will populate what level of Medicaid they have, if they have LIS or extra help, and what percentage. What else does it tell you, Joe? Do you know?
Plan type.
Plan type, right? You can toggle over. I know you can't see it, but up in this pink box, if you toggle over to Medicare eligibility, it'll tell you their like eligibility date. It'll tell you what plan they're on. You can take that, type it into Google, and it'll tell you like exactly what plan that is. It just populates a ton of information right at your fingertips. So you don't have to, when they give you like all 10 cards and are like, I'm not sure what plan I'm on. Well, this tool will tell you in about 30 seconds. Joe touched on it at the beginning, but everyone gets this Visa debit card, right? But if you're a dual eligible, it's loaded with a monthly amount that rolls over for 2024. It did not roll over month to month right now, but it will roll over month to month in 2024. And you can use it on, like, this was the big fanfare this last year, right? But you can use it on all these different things. Yes, you can pay your mortgage or your rent with it, your utilities, and all that fun stuff. And if they want to use non-medical transportation, like we do have the transportation benefit, but they could pay Uber and Lyft with it too. All right, for those in the greater Detroit area, we still have the HMO DSNP option. We did a little bit just by adding a couple counties and bumping the vision, but overall, not a ton of change this year. If you're in this area, though, you did not have a PPO option, and you do now. Hooray! We expanded the PPO DSNP to statewide. It's in every single county now. So if you sell in that Metro Detroit area or Ingham County, Genesee County, you now have a PPO option if network is a concern. Now, the HMO has the 175 a month. This is going to have 120 a month. So there is a difference there. And it has a lower on the dental, including dentures. That was 3,000. This is 2,000. So there are some trade-offs when you're moving into a PPO DSNP. We did expand it to all 7 levels of Medicaid eligibility, including spend down can go in this. Spend down does still apply though. Okay. But I think this is fantastic because now there's so many more people who can take advantage of all of the wonderful, great things that a DSNP plan offers. Yes. Yeah. Spend down is going to apply. So yeah, let's say they have a 20% spend down. Okay. That they will pay that 20% until that is met, and then that will kick in. So you do have to weigh whether this is going to be more advantageous than, say, the zero premium PPO, which has like the spend down wouldn't apply, right? The set copay would apply. But with this, the spend down is going to apply. However, if you're not in a DSNP, you're not getting, dentures on the dental. You're not going to have transportation. You're not going to have that monthly healthy options amount to spend on your rent, your gas, utilities. So there's trade-offs here. You do need to do like a needs analysis and figure out what's going to be the best scenario for them. Spend down, folks. Okay.
So again, anybody on the PPO DSNP is going to transition over to the new contract number, the 385. So just keep in mind, if you did have people on this plan in 23, or do have people on this plan in 23, and go to the next one.
Hold on, we have a
Oh,
question before we
okay.
go. No, the
Zero.
copays are zero
Zero.
on prescriptions. So spend down is, spend down's going to apply no matter what. Okay. Everyone else though, zero. Now, everyone outside of the Detroit area, right now, this PPO DSNP is what you currently have, but you're also going to have another option. We have a new plan. It is also a PPO DSNP. It is identical to what I just showed you. However, you get $190 a month with rollover. You can only put 3 levels of eligibility in here though, guys, and it's the folks that need it the most. These 3 levels, if you have people on your book of business right now in these 3 levels, please start having the conversations after October 1st of moving into this plan. It is likely that they will want to move. There are no differences other than only 3 eligibility levels can go in, and you get $190 a month instead of $120 a month. Greater Detroit, if you're sad, I'm sorry, but yes, you get the option of the HMO that I showed you first, and then that PPO I just showed you. This PPO is not in your area. I guess, who knows?
Cool.
Let me flip back. I know people like to compare and contrast. That's the existing one with the expanded eligibility.
So if they're FBDE, Quimby Plus, or Swimby Plus,
Then
you're going to want to move them to the new
this.
plan, the 388.
Okay. Does that make sense? But with this plan, the existing one, you now have so many more members that could go into a DSNP, right? Okay. Yep, they're all the same. Every single PPO, it doesn't matter the type of plan. With Humana, it's fully open nationwide. As long as they will bill, we pay it at in-network cost share.
I think this is the last one.
Yep.
So
Last one.
last one. So new for 2024, we do have a CSNP this year. So C stands for chronic. Has anybody ever sold a CSNP plan before? No? A couple of us? Okay. So there's a number of different types of CSNP plans. There's an ESRD CSNP, there's a lung CSNP, but in Michigan, we have a diabetes and heart CSNP. So when you complete the application, you'll have to do the pre-qualification question. It comes in all the booklets that you'll order and that you'll get, or if you do anything online for an application, it'll be on there as well. There's 3 questions regarding diabetes, 3 questions regarding heart. They just have to answer yes to one of those, and then we can submit the application as is. And then the second part of that is the verification of chronic condition. There's a form, a VCC form, that has to be completed by a provider, a PCP. They have 60 days to get that in.
Those are the 2 forms. I will, yeah. I just wanted to, because he was talking about the forms.
Yep.
These are the 2 forms, and I don't want you to get scared. Like I've seen these forms. Again, the pre-qualification form is like a checkbox of yes. It's not super difficult. And the VCC is 1 page. It's a 1-page form that the physician basically is verifying that that they do actually have diabetes.
So we as agents aren't doctors, right? We're not MDs. All we do is fill out the question. Member says they got diabetes. I guess we take their word for it. As long as they can answer, the question that says yes, doctor's the one that has to kind of go through that. I would encourage you to do a really good needs analysis, because as we go through these, it's got a $5,900 MOOP, $0 to go to a PCP, $35 to go to a specialist. Is that better, any worse than any of the other plans? I don't know. But I would encourage you to do a really good needs analysis. This plan does have a 6th tier on drugs. The 6th tier is the tier that treats the conditions of the SNP. In this case, it's a diabetes and heart SNP. So we'll have diabetes and heart related RXs in that 6th tier. And that 6th tier is not subject to the RX deductible. So 1, 2, 3, and 6. 1, 2, 3, and 6 are not subject to the RX deductible here. But again, we just want to make sure we're doing all our due diligence to get this to go through as far as to get processed. You have to fill the pre-qualification form out to make sure that this plan goes through. Yeah, question. Tier 6 deductible does not apply. Say again. Does it count towards the coverage gap? You know what? I'll check. We don't have the EOC yet or the summary of benefits yet. That's a good question. I'll get back to you. Yep. Yeah. We're not capped on the enrollment. So the SEP is SEP CHR. So good question. And there's not like a limit on how many you could submit through. I will say if you submit this through, right, you do the pre-qualification form, member says they're diabetic, you submit it through, doctor's like, hey, this guy's not diabetic. You have a bunch of those different scenarios where you submit it through and it doesn't go through because doctor says that these members don't have the disease state. We will monitor that. So if you send 10 of those through and then they all get denied, which again, after 60 days opens up an SEP again to get into a regular plan, we will monitor that. I think I guess was that your question? Yeah, we don't have a limited number. No. And then again, this is an SEP every month of the year. So it's a really big, outside AEP, outside OEP play. I mean, 1 in 3 seniors is some form of diabetic. I mean, this opens up a massive opportunity for us and for you. Was there a question over here? Did I miss one? Yeah. Sure. Agreed. Yep. Yeah, we don't have the summary of benefits yet, so we'll have to check on that, or the formularies for that matter.
Yeah,
So we'll have to get into that. But, I mean, valid point. It could either be a home run or not, depending on whether that's true. But again, we'll get back to you.
And as soon as we do have the formulary, believe me, like we've had to present this how many times already? This is the exact same questions we get the whole time. I'm like, is this on tier 6? Is this on tier 6? As soon as we have it, we will make sure it's disseminated so that everyone knows, because you're right. It really is a game changer on how this is going to look.
I think there was another question over here somewhere. Maybe the question? No, good.
Okay.
Okay.
Well, that's what you need to know for plans. I'm going to just go over a couple other things. These are not important. More stuff you need to know, not a ton. Reminder that Silver Sneakers is on all of our plans. It's that gym membership at no additional cost. They don't even have to go to the gym though. Like if they want to go to Pizza Fridays at Planet Fitness, go for it. Or if they want to go do a cooking class at YMCA, just have them join their, as long as it's Silver Sneaker on the Silver Sneakers website, have them join. It doesn't need to be necessarily working out.
And the Silver Sneakers plug is, again, the Silver Sneakers, there's no rep there, but they were there. They were with us yesterday. And if you go to silversneakers.com/preferred agents, there's some really good Silver Sneakers flyers out there for agents. Again, for every other carrier that has Silver Sneakers as well, not just Humana, but there's some really good Silver Sneakers flyers out there if you're interested.
And with Humana, every time they go to a Silver Sneakers location and check in at the gym, they earn points, as well as when they get their flu shot or their colonoscopy or mammogram. All those claims, and they don't have to do anything. It's not like they have to report it. They flow through the system and they tally up. And then your member just has to redeem, call in to say, I'd like to redeem my points. And then we mail them gift cards. This is on every single plan, you guys. 7% of our membership actually redeems it. 7%. And you can get up to $260 right before the holidays. I don't understand. But anyway, it's one simple thing. You don't have to do anything. The only thing is you as an agent has to do is make sure you say, hey, call member support, member services, and get your gift cards redeemed. Just a reminder, because you kind of forget about it when you started the plan back in January. So
this is an excellent service. I mean, we have this as Humana employees every single time I walk. My wife gets so excited because she's going to get a Home Depot gift cards or whatever she wants to go buy, Amazon gift card. So, every 10,000 points is $1, or every 10,000 steps is $1. If you get a mammogram, it's $50. Colonoscopy is
$30.
$30, whatever it is. Every single service that we're receiving, we get some sort of benefit for. So these seniors are doing this already. They might as well cash in on some of the points. It's like using one of those, miles credit cards. Every single time you swipe it, you get some sort of point. Every single time you receive some sort of care, you can receive points. Again,
plus Hello, referrals and retention.
For sure.
Start talking like, I got all of this. There's
It's automatic.
automatic.
If they call the number on the back of their Humana card and say, hey, do I have any points? Go through 65 points. We can look that right up and tell them.
Yep.
Yeah.
Yep.
Yeah, you can. There's an app they can download, or some seniors don't have a cell phone. You can go to the MRC, the Marketing Resource Center, and there's a paper form that they can fill out. It says, did you go to a silver sneakers class? They check yes, and then they can mail it in or fax it in or give it to you, and you can take a picture and email it in. We try to make it as easy as possible, but there's paper forms on the MRC, or they can just call the number on the back of the card.
And just a reminder, some are automatic, like the flu shot and things like that flow through the system. But if they really want to get super involved and they want to report their like daily Bible reading and things like that, seriously, that is something they can report those and keep adding up points and get more money.
So Humana does own our own pharmacy. I hope you all have heard it before. It's changed in the last couple of years. It used to be called Right Source. And then we thought really long and hard, had meeting upon meeting, and changed it to Humana Pharmacy conveniently. And then we rebranded ourselves to Centerwell Pharmacy like 18 months ago. It is a regular pharmacy and a specialty pharmacy. So specialty drugs are usually tier 5 drugs, rheumatoid arthritis, neurology type medicines, but we can do it all. All they have to do is call the number on the back of their card, and they can get their prescriptions mailed to them. Again, the advantage is, as we all know, seniors, we don't want them to drive if they don't have to, right? So if we can give them the number to Centerwell and they can get their tier 1, tier 2 drugs mailed to them in January when they don't have to drive, why not? I mean, if they want to go to Meijer or Walmart, fine. But if they want to get their drugs mailed to them, they can. The other question I'll get is, well, I have people that go to Florida for 4 months. All they do is they call the number, the Centerwell number, and we just change the address, and we can ship those meds right down to their address in Florida. That's not a problem. We do that all the time. Question? No? Yes, question, yeah. Oh, absolutely. No matter what state, yeah, we'll deliver anywhere. We have we fill out of our pharmacy. Oh, absolutely. You don't even have to do that. You don't even have to do that. So the question is can they go to any doctor nationwide, right? Our networks are even our HMO is a travel benefit, nationwide travel benefit, and our PPOs are as well. I think that was it. Go ahead.
We still have this health survey or health risk, whatever you want to call it. We call it the health survey now. It was called member care assessment. It's still $60 a pop, new to Humana. Everyone asks me how to do it. I'm like, it's in your research. Did you read it? No, you just click through it. I know. If you have not taken 30 seconds to sign up for Humana Reach Rewards, you probably did it 5 years ago. You probably are like, am I even signed up? I don't know. But you earn points for everything, including sitting here. And they stack up real quickly. Like new to Humana, 75 points a piece. Just to get to bronze, it's only 500 points. Well, if one is worth 75 points, it's not going to take you long to get 500 points. And it dumps $50 in I call it our online store, but it's called the Marketing Resource Center because we want to give names to everything. But your online store, you can buy yourself a polo or a nifty backpack like I have back there. And it just adds up as you go. My point is if you, as much or as little as you do, you can still earn money to spend like on things. If you want to buy 500 jar openers, you can.
And if you're not signed up, seriously, come see us in the back. We can help you. I've timed myself. I think it's 34 seconds is my record. So it's really, really quick. Just literally type
One
in
and
your,
done.
type
Not
in your
every
email
year.
address. I can look up your SAN number. It's super quick. Not a problem. So if you're not signed up, please see us because you're missing out on points and things you're doing all day, every day anyway.
And these are some fun things you can get out of the Marketing Resource Center.
The Marketing Resource Center changes all the time. We're always uploading new documents all the time. So make sure that that you're checking that out. I mean, you can customize them. You can put your beautiful face on a picture or on a flyer if you want. You don't have to. And you can put Facebook link, email address. If you have a
can
business
change the
URL,
pictures.
that's great. Yeah. So if you want to put my picture on there, you're fine. You can. I can give you my high school picture. It's back there, and you guys can put it right on your flyers if you'd like. It is. It's my high school photo. Yeah.
We always joke, like we're the same age, but you look at like a whole decade younger than me. It's not fair. I'm just gonna skip that. All right, this is what people want. If you sell in Detroit, Ingham, and so on, take a picture of the top section. If you do not sell in Detroit, if you're in Grand Rapids like me, take a picture of the bottom. And those are the plans that you would want to sell. I know there are other plans out there. We do not retire any. We like to let every single plan have a forever lifetime. So these are the only ones you should be selling.
So when you order, they're booklets, not boxes, right? So if they put one, it's booklet, right?
Right. So when they come in packs of 40,
There you go.
if you order less than that, yes, you do run a risk of getting an envelope with one booklet in
Right.
it.
Come in packs of 40. So when you order, make sure you just know that, because in the past we've done boxes. This year it's booklets. So if you want to order, if you put one, you're going to literally get one booklet, not one box. There you go.
That's it.
So to recap, you want me to do it? Or do you want to
Go for it.
recap? So we've got some really good core plans. I would say if you're selling in Metro Detroit, you've got a really, really solid, rock solid HMO. If you want to go with the PPO route this year, $15 give back, really, really big deal, really attractive to seniors. They're all looking for those give back now. When we talk about the DSNP, 3 DSNPs in the state of Michigan, HMO, in Metro Detroit, we have a statewide PPO, again, that accepts all levels of Medicaid. Brand new DSNP this year, and everywhere, I think, except for 10 counties, maybe 13 counties, that has a $190 rollover on that smart card. I think that's going to be a big deal in 2024. And then don't forget about the honor plans. If you're in that space, 2 different honor plans to choose from, one with RX, one without. The one with RX is a $70 give back, one without is a $100 give back, and then the CSNP. We'll get some answers on the CSNP, and you'll get that. We are going to have some CSNP specific trainings for your, we'll blast those out to you guys. If you want to join them, please do. We'll have some of those answers. But again, 1 in 3 seniors is diabetic. So we want to make sure we can take care of that population the best way we can. And we feel like we can do that with our CSNP in 2024.
Check your email for Anna Bonet. I sent it yesterday. The links for the 2 CSNP trainings.
Yes.
So
And mine
It's
is
just yesterday.
Jerka, J Urka. It's Jerka, but it's J Urka. They would not switch it for me. I asked them to.
All right, and
yeah.
this is just the helpful line. I get lots of questions, like technical support questions, and I am not techie. Like I couldn't help you if I wanted to. And so this is definitely the line you'd want to call if you're having issues with uploading your AHIP scores or whatever. I just don't have even the system to be able to help. So they're awesome. Okay,
Thank you guys. We'll be in the back. We got some cool notebooks. We'll be back there if you need us.
Chris, you have a question?
So I just got a quick question. You referenced earlier your plans are working with Mayo Clinic. You're like one of the only Advantage plans that they're accepting then? Most of the other carriers are saying that they're not. Okay.
That was a good question. Thank you, guys. Appreciate it. All right, guys, it is almost right about 10:30. We're going to take a 15-minute break to go and do what you need to do. Check out. If it takes a little bit longer, we'll wait for you, but let's go ahead and get started with that, and then we'll hear from Molina next. Thanks, everyone. Yeah. Well, it should, I mean, 20 minutes is more than enough unless they had a pack. All right, guys, we're gonna get started here shortly, so please come grab a seat. The reality is we're okay because lunch is right after this. Right. So, I mean, we were ahead, so we got. What I need is the next two carriers to be able to speak to Dallas. Does this have to? No, because it's connected back there, so it just. Everyone struggles a little bit with it, so you just. Let's get this done, baby. Yeah, no. All right, guys, let's go. I got some impatient people up here, and I'm not talking about Molina. We did find a card. If anyone's missing their room key card, just come and see me. It's to this big old suite. No. All right, guys, we're gonna go ahead and get started. We'd like to introduce you, Jonathan from Molina, is going to talk. Well, Javon's going to do some talking, but I'm going to let Jonathan introduce Javon. But warm welcome for Molina.
Thank you, everybody. Morning, how is everybody doing? All right, I'm going to start out with just a gentle exercise to do me a favor, to appease me. I'm not really active on social media much, but I am on LinkedIn. So if you guys would do me a favor and just stand up. Yep, just stand up. Yep, stretch out a little bit. I'm going to record something. Just to appease me. On the count of 3, if you would all just say, "Let's go, Molina," at the top of your lungs. All right? All right. Wait, what's that? Oh, do you want to do a practice? Okay. I'll do it, but I'm Mike, so I'll be loud. Let's go. All right. Are we good? All right, here we go. 1, 2, 3. Let's go, Molina. Thank you so much. All right, so that being said, thank you for 4TBrokerage for letting Javon and I here speak. A couple of announcements. First of all, I want to introduce, if you haven't met, which I'm guessing many of you have met, our national account manager sitting at the back near a table, Joe Lukasik. Say hi to him. He's waving profusely, so if you want to turn around and say hi to him. Yep. And as we introduce our plans, because many of you may or may not know a little bit about Molina. Molina is a conservative company by nature. They tend to do certain things, many things conservatively, as you'll see, as Javon will present our preview for 2024. We market ourselves as a medical insurance company. Okay? A medical insurance company. We're not a food and produce company. You'll see that as the presentation goes along, as many of our competitors are. And thirdly, we do that intentionally for sustainability reasons, because we want to be in play. We are the fastest growing MAPD plan since 2022 by the numbers according to CMS. And so we want to let you know that as we kind of train you a little bit about Molina. So we're conservative. We're a medical insurance company and we provide sustainability. That all adds up to CMS. So with that, I will introduce Javon. Javon is our West Michigan broker channel manager.
Thanks, Jonathan. I think I'm going to actually let you do the clicking. Yeah, it's not clicking. Well, I don't want to focus on that. Yeah, so I got a chance to meet a lot of you. I'd like to meet even more of you. I'm from Grand Rapids, as Jonathan mentioned. He and I basically split the state down the middle. I cover basically Sheboygan, which is now in our service area, all the way down to Indiana on the west side of the state. Okay. Just a little bit about myself. I'm going into my 9th year with Molina Healthcare. I started in 2014 as a field sales rep. And so that's how I got my start, doing what a lot of you are doing every day now, field work, enrolling people in their homes and that sort of thing. And so, Jonathan, let's go to the next slide there. there's our disclaimer. Our plans will be public October 1st for distribution. Okay, so a little bit about Molina Healthcare and how it got started. Molina Healthcare has been around about 37 years, 37, 38 years. It was started by Dr. David Molina in Long Beach, California. You might know that story. Dr. David Molina was an emergency room physician who spent most of his time seeing people in the ER with non-emergency type situations. Okay. So when you go into the ER, you don't have insurance, it's not an emergency, you know what happens then, right? The bills start coming in. So what he decided to do was open his own practice and focus mainly on the underserved folks in the community, those who were overlooked and really didn't have access to a lot of the resources, didn't even have a provider that they could see for health maintenance, you might say. Okay. So a few bullet points about Molina. We're ranked 125 on the Fortune 500, 5 million plus members right now, still headquartered in Long Beach, California, and 15,000 plus employees. Okay. Thanks, Jonathan. Here's our Medicare footprint. Okay. So in the teal, you see the states in the teal, those are our existing states that we have Medicare products in. Okay. In the kind of burnt orange colors there, Indiana, Nebraska, those are expansion states. So in 2024, we're going to be adding both Indiana and Nebraska in our service, as our markets in the country. We're exiting both Florida and New Mexico for 2024. Going to consolidate. That doesn't mean we'll never go back to those states, but for 2024, we're withdrawing from Florida and New Mexico. So on this slide here, actually I'm missing a detail there, but we have 676 counties as of right now. And then with the addition of the 2 new states and factoring the market exits, we're adding 158 counties. Okay. And so for a total of 816 counties in the country. Okay. So Molina's growing. So now let's kind of take a look a little bit more local to the state of Michigan. We can go past that one, Jonathan. Okay. So here is our service area. Okay. So all of the teal is where our plans are. Our DSNP plans, our MAPD products are in the teal portion there. Just to touch on this, I'm in Grand Rapids. When I first started with Molina, our service area in West Michigan was Kent and Montcalm only. So I spent most of my days traveling back and forth from Grand Rapids, Edmore, Howard City, those counties, and that's where we were. But you can see where we've expanded up to this point. We've got almost the entire state now. The counties right here in the center section, Ingham, Clinton, and the other 2, they're not here. But then Berrien here and the lower western side of the state are not in our service area currently. Up at the top there, you see Sheboygan and Presque Isle are going to be our new 2 counties that will be in 2024. Now, if you see the dot there, that means those states have all of our products there as far as Medicare goes. Okay, so they've got our PSNP products and our 2 MAPD products. If you see the teal and then the orange dot within that state there. Okay. All right, let's talk about plans. This is kind of just got kind of a high level view. We don't have the plan designs available to hand out to everyone. They will be available soon, but these are some of the highlights of our products. So we have a side-by-side comparison. Left side is our full dual, partial dual on the right side. I don't know if you can see all those details there, but take pictures if you would like. So just moving down, we'll just kind of move down one and then hop over to the other side. So the full, Did you go too far, Jonathan? Okay, there we go. Complete care. These are D-SNPs. The other slide we'll get to later. So our full dual and partial dual, okay? Zero premium, all of our plans. PCP and specialist copay, 0 and 30. Okay, yeah. Acute, inpatient, acute care is gonna be $0 for the full dual, $125 a day, days 1 through 6, 0 days 7 through 90. Prescription drug deductible, 0 on both. I'll touch on this now for the sake of being concise. Who's familiar with VBID? That concept of VBID? Okay. So this year, what Molina has done is taken advantage of this VBID program. And I'll just lay this out here. If the person has D-SNP, is a D-SNP with LIS, they won't pay any copay for their medications, generic or brand name, provided they're in the formulary. That clear? Okay. All right, because there's another slide with a lot of details that can get confusing. So I'll just touch on that part right there. The MOOP 8850 and 8850 for both products, right? We put that there to be transparent. A person's Medicaid situation can change. They need to know that it's possible that they could have that exposure if something were to happen to their Medicaid status. Chiropractic. Might need to step back here. I'm having trouble seeing all my stuff. Okay. Oh, that's better. So 20 visits per year on each plan. Full dual has a $4,000 dental allowance. Now that allowance is not used for preventive care. So it doesn't eat into their allowance to have x-rays, fluoride treatments, that type of thing. The $4,000 on that product is for comprehensive. That's how that $4,000 is used. We'll touch on the dental on the partial dual here shortly. Both plans come with a fitness benefit that you can use at several places in Michigan, Planet Fitness, MVP Sports. There's a whole list, and you can go to silverandfit.com for a list of some of the others. Hearing benefit, routine hearing exam, 2 pre-selected hearing aids. Person needs hearing aids, Molina will pay for 2 pre-selected hearing aids every 2 years. Meals, we use Mom's Meals Nourish Care, 56 meals a year. Person leaves the hospital, they're not able to cook for themselves. Molina will provide up to 56 meals for them after release from the hospital. Then we've got transportation to all of the members, doctor's visits, PCP specialists, dentist, eye care, pharmacy. We'll take them in any of those places for free. It does say 30 one-way and 10 one-way on both of these products, but the Medicaid, Molina, will allow them to have unlimited rides. So basically it will go from one to the Molina Medicare to the Molina Medicaid, and they can continue to get rides even after the 15 round trips are exhausted under this product. Then we have the PERS, Emergency Response System. We all know what that, the old "I fallen and I can't get up," that benefit is good for the individual who, if they fall, they're not able to get to a phone or something like that, they can press that button. Interestingly, one of the other things that benefit can be used for, and this was mentioned to us right after COVID, is some of the elderly population, because of the constant isolation and loneliness that they experienced during COVID, they actually could use that system just to talk to someone, even if it wasn't an emergency. So they could just press that button and they could just talk because maybe they didn't have family or friends nearby. Podiatry, 6 routine visits under the full dual. It says not covered under the partial, but podiatry is a covered Medicare benefit. You got neuropathy in your foot, then Medicare will pay for that. So they'll pay for it too under the partial, but it's the routine care, toenail clippings and things of that sort that are not covered under the partial dual product. The Vision offers a $350 allowance for eyewear and a free routine eye exam every year, and then a $10,000 allowance to get you back home and stable. If you're traveling and something were to happen, it will get you back home and stable. Now, the My Choice card, the SSBCI benefits. As Jonathan mentioned, we're a Medicare company offering medical benefits to people. We do understand that people have food needs, and so we do provide some allowance for food and produce. It's $50 for the full dual a month, no rollover, 40 a month on the partial. Okay. They do have to qualify for that. An HRA has to be completed for that. The person has to qualify for that. Now, some of the other carriers we know don't have to have one of those completed. The benefit of having one of those is not just to get the person to qualify for food and produce, but it gives Molina a better idea of the needs of the member. When they complete that HRA, it tells them not only that because of a chronic illness, they may need some food if that illness can be managed by a better diet, but it tells them if they've got other health conditions that they may need case management for, and they'll assign a case manager. It gives them a more complete picture of the member's health. And so we ask that that HRA be completed and turned in, even if the person doesn't qualify for SSBCI. We'd like to have that information. Okay. Now, for over the counter, we offer a $370 allowance a quarter, no rollover, $225 a quarter on the partial. Nice, big, robust catalog full of over the counter items. Those items can be ordered online, in person, using the My Choice card, or they can just call and order over the phone. Okay. Now, some of the other SSBCI benefits that the member would have to qualify for is pest control, animal supplies, mental health and wellness. For the animal supplies, perhaps the person has a service animal they need to provide food for, or an emotional support animal. If they have that need, there's a $150 allowance a quarter for each of those buckets that the person qualifies for. Okay. Case manager goes to the member's house. They notice bed bugs, roaches, mice, those types of things. The person can hire a pest control company to come in to eradicate those pests. Okay. All right. So dental. So we talked about the dental on the full dual. Now let's just touch on how it's going to work in 2024 on the partial and the one MAPD product. The way the dental is going to work is because preventive services are covered without a limit. Okay. Molina is going to allow the person $1,000 loaded onto a card that they can use at an out-of-network provider. So Delta Dental PPO, if they don't participate, the member can take that card and go to a different provider and use that $1,000 allowance, maybe for something, sorry, get a drink, maybe for something comprehensive. So that gives them that flexibility. All right, Jonathan. Yeah, all right, cool. Okay, so now we're on the MAPD products. A couple years ago, Molina decided to begin offering this. Molina started as a Medicaid company, people that were low income. But we decided to begin offering Medicare products, MAPD products. We had a lot of people on the marketplace aging in. There were nowhere for them to go with Molina. They had to leave and go with another carrier. So we started offering Medicare Advantage products for people that did not have Medicaid. So we've got the Choice Care Select, or we might call it the buyback, okay, or rebate, or there's all types of words for it. Both no premium. Now, for anyone that's new, make sure you remind your member they still have to pay their Part B premium, right? Don't get in trouble by explaining that the plan has no cost and they think they don't have to keep paying their Part B premium. They do. Now, on the primary and specialty visits, you've got a 0 and 40, a 0 and 50 respectively on the two products there. Inpatient acute, 325, days 1 through 6, days 7 through 90, 0, 450 a day, days 1 through 4, and 0 days 5 through 90 on the buyback. Prescription drug deductible, $0 copay for tier 6, a one-time deductible of $125 for tiers 1 through 5. The explanation of benefits will have the actual copay breakdown, what happens after the $125 deductible is met. Buyback, $375 for tiers 1 through 5, excuse me. So they've got to meet that. The MOOP is $8,300. Now, let's just finish off this side. These, and some of our other counterparts have mentioned that this type of product may be for those who don't need dental, veterans, they get their care from somewhere else. Some of these other areas may not be important to those individuals. Maybe the $110 is what they'll make use of more than meals. Okay. So where it says not covered, it's not covered for those categories on the buyback. On this one here, the 006, chiropractic and acupuncture, 12 visits a year, fitness, hearing, meals, even transportation. Now I have a question. I haven't seen everyone's first looks, but are there many MAPD products that offer food? There are a lot of them. MAPD only. Okay. MAPD only, not DSNP. There are a lot of those that offer food? Okay. Wasn't sure. All right. So we give our folks $55 on this product every month. They can qualify for a food and produce allowance. $115 for over the counter and the $150 a quarter if they fall into any of the other SSBCI categories. The dental we talked about, the $1,000 in flexibility for out-of-network services or comprehensive services, additional comprehensive services. So those are some of the high points. Jonathan, are we going still? Okay. All right, cool. So Michigan network highlights. See our hospitals? Henry Ford, Corwell, maybe we still know them as Spectrum and Beaumont. They merged. Ascension, U of M, Oak Street, Sinai, Grace, McLaren, Genesis, Mid-Michigan, Munson. Don't forget about Terry Street Clinic in Grand Rapids, Greenville, right? Those places all take our products. Now, let me just make this statement here. Spectrum Health this year and next year doesn't take our MAPD. Okay, so our provider people are working on that. We want Spectrum taking all of our products right now, DSNP only. Pardon? So not necessarily, because Beaumont still takes everything. Beaumont still will take both DSNP, both MAPD. Spectrum Health doesn't, even though they're both Corewell Health now. Pardon? You can put it that way. Yeah. So we're working on that though. We have meetings monthly about where our provider engagement people are in the process of getting Spectrum Health on board with our MAPD. Yeah. Yeah. Okay, this is the one we can fly by. It's more details on how the dental works with $1,000 flexibility. That one too, the value-based insurance design that gets our prescriptions at 0 for both generic and brand name if they have LIS. And then here's a little bit more on the health risk assessment. We'll give you $100 if you complete it and you send it in before the member becomes effective. You can do a paper one. We prefer the electronic. Yeah, we prefer the electronic. So if you use the DRX Connector platform, the last page of that, you can click on the iCario link. You could go to that website and complete the HRA electronically. That's our preferred method for getting those done. But if you do them, we'll give you $100 for each. Okay, so how many have used Connector before or something similar? Okay. So DRX Connector, we've been using a few years now. We're going to be integrating into this platform an eligibility checker. So maybe you're used to calling the BSU if you do any Molina business, the broker service unit. Hey, I need to check the eligibility on this person. Well, what you'll be able to do is check their eligibility here using the MBI and date of birth. So you'll be able to check the eligibility right here using the DRX Connector site, and it will tell you which products the member is eligible for to enroll in. All right. Now here's one other new thing for 2024, the Molina Marketing Center. We're really excited about this because one of the best features about it is you can order your own marketing materials and configure them the way that you would like. So maybe when you're meeting with a member or a prospect, you're used to explaining things in a certain order. Well, you can configure the flyer in that order. So if you like talking about OTC or you like to talk about the rides or whatever it is, you can organize that flyer the way that you would like and how many you want, and just order them. They'll send them to you. Okay. So in addition to that, on those flyers, they have the ability to put a QR code. So when the person scans that QR code, you can actually it'll take them basically to you, your information, your contact info. Yeah. And one thing I'm not sure of, I think it's possible to get right to the Connector site. I'm gonna have to go back and double check on that, but it'd be nice if the member with just the flyer could scan the QR code. It takes them to the platform to enroll. You get credit for that enrollment. Well, all right, so the MAC, the Molina Agent Center is a resource that you can all use to find out when trainings are happening. You're able to look at certain resources, CMS News, the telephonic script that's approved for use in enrollment. Hopefully soon you'll see some of the additional upcoming trainings that Jonathan and I are having. Next week, we're going to be doing axe throwing, followed by a presentation of the 2024 benefits. So if you're in Grand Rapids, come throw some axes with us next Friday. Yeah. All right, so the scope of appointment rule, is everyone familiar with this? What CMS is explaining that we need to do now? Back old school? Okay, there's a few exceptions. Scopes that are completed during the last 4 days of a valid election period for the beneficiary, including AEP, OEP, SEP, ICEP for the month. You don't have to follow the 48-hour rule. Unscheduled or in-person walk-ins initiated by the beneficiary, including a member-initiated inbound call or inbound web chat. Okay, so those are the exceptions for the 48-hour rule. All right, so I talked to a few of you. Not everyone is ready to sell for Molina. How do you get ready to sell? Complete your AHIP. We'll give you a $50 discount toward that training. And then there's about a 20-minute Molina certification that you have to do right after. The AHIP takes you right there. And then you can complete your training, get contracted, and start selling for Molina. Okay. Enrollment options. You can call the BSU, have your recorded phone call, do your recorded scope. Old school, you want an enrollment kit, paper style, we've got those for you. or you can use the Molina DRX Connection website for your enrollments, which is the preferred method. Okay, so these are some of the sites that we've already discussed. I don't think we touched on the provider online directory, but you can find that at molinahealthcare.com. We call it the pod. It's where you look up providers that are in the network and taking all of our products. There's a formulary lookup. If you're taking pictures for that, it's molinahealthcare.com, and there's a formulary button that you can click on. It'll take you to those. The Mac we talked about, and then the Molina Broker portal, where you can keep track of your book of business. Okay. SCPs. Okay. We're not going to go into all of the SCPs. The list is pretty lengthy, but there are a few ones that maybe we're familiar with: lost or gained Medicaid, moved, change in LIS. In one of the slides that on my presentation, I add FEMA.com/declarations, because that site can help me find out where there's a state of emergency and maybe the governor has declared that, and that may allow a person to change plans. If they're stuck, they can't move, they can't shop, they can't do that type of thing. So I usually include that piece on this slide. Okay. And then here we've got the important phone numbers for Michigan Member Services is right there, 800-665-3072. And that's all. But before I turn it over back over to Jonathan, why Molina? That might be what you're asking. Why Molina? Besides the product, and the product's good. Besides the product, I would say Molina because you've got Jonathan and myself. I've been in the insurance business since 2003. I know what it's like to be in the field trying to find business. It wasn't until very late in my career that I started getting most of my business through referrals. Everything was grinding. So I like doing that still. So if you don't feel comfortable with the D-SNP population, I do. If you want me to come and present somewhere that you're trying to get into, senior building, low-income housing, food pantry, I will come do the presentation for you. If you're meeting with a member, I will meet with that member with you, help you walk through it. I'll travel anywhere in West Michigan to support you. If you need a table somewhere, you can't get in, call me. I'll get you in that place. And I know Jonathan will do the same. So thank you for your time, Jonathan.
Yeah, we're not quite done. Hold your applause, but you want to take over? All right, we have probably about 5 to 10 minutes left, unless you guys have any questions. We're going to our appendix here. So this slide just details some of the things our member services can do for you guys on the debit card that Javon talked about. Next slide. All right, the HRA process. So we use a third-party vendor called Icario, which you can find all that and more, a bag of chips on our Mac, the molinaagentcenter.com, as far as resources and training. But the process is pretty simple. You enroll the member. The member contacts the 800 number that Javon just gave you. The member services does a warm transfer to our case manager. The case manager is a key cog in the whole deal. They hold all the power on determining. Now, about 9 out of every 10 qualify for those additional food and produce and other SSBCI benefits. So presuming the case manager uses your HRA, we pay you the $100. They authorize those additional funds depending on the plan, all of them except the buyback plan, into the additional debit card for your member. And that's just that just speaks to what Javon talked about earlier. This is one of the selling points for Molina is our case management. Again, I talked about the fact that Molina Healthcare is an insurance company, and we strive to really hone in on the member. One of the best ways we do that is through our case manager. So our case manager, again, key cog in giving that member uber detail and attention. And the concierge team, we developed this team last year at this time. So it's a year old. And we do what the concierge team is again, Molina is really a company, and I need to stress this, that works on the inside out rather than the outside in. So we may not wow you with our plan or plan designs, but they're good enough. What we try to do is make it broker and member focused. This is one of the ways that we do that. The concierge team basically contacts new members within the first 90 days of their enrollment, and they make them feel warm, fuzzy, and welcome at home. But in addition, on the back end, if there happens to be issues per se, right, they will contact, and we just came back from Chicago in our sales conference where we detailed calls from upset members that our concierge team was able to resolve. So they will do that not only for the member, but also for the broker if there are any broker issues. So we thank you. I would just want to close with a few closing remarks. Again, to touch on why the Molina, as Javon was speaking to, excellent member and customer service and broker services. Javon talked about the attention to detail that he and I would give to you per se, coming alongside you, as we both are here to serve all of you. High retention. So many of the brokers in Michigan tell Javon and I that many of the members love Molina. So typically, if you will sell Molina, they typically will stay with you, and hence your retention will be higher, and you'll have less customer service because of our excellent broker services and member services. So just make us a part of your offering. We're not the sexiest carrier out there, right? But we aim to improve on the broker services and the member services side, coming alongside you. And ultimately, what Molina wants to do is they want to make it easy for you guys to do business with us as well as the members. With that, any final questions for Javon and I? All right, well, thank you so much. And hand over to Sunny, who will introduce lunch, I think.
Thank you, Jonathan and Javon. Appreciate your time today. It was a pleasure meeting you. So we did talk to the staff here. They are going to bring out lunch about 15 minutes early, but that still means we have 15 minutes till then. What I'd like to do in that time, if we can, Laura, can I get 5 minutes of your time? I've had a few people come up to me and ask me to let you speak. So come on up. The value of what they do to help you guys with your patients with diabetes is tremendous. And if you haven't had a chance to talk to her, you're going to learn about it today. And then we're going to have a webinar in a couple weeks to dive into really how they can help you. Right, exactly. That's right.
Thank you so much. I probably don't need the mic, but I'll try it. If I'm a little loud, I apologize. Well, thank you guys so much. And thank you, Sunny. And thank you for advocating for me, those of you that wanted to hear a little bit more. So who are we? If you haven't had a chance to stop by, we are Advanced Diabetes Supply, ADS is what you'll hear us called. A lot of you may know us from our national contract with UnitedHealthCare because they're great partners. But what you don't realize is that we have other partnerships as well. And I think that's been my biggest takeaway from the last 2 days is that you don't know who we're contracted with, right? So we are contracted with Aetna. We are contracted with Wellcare. We are contracted with HAP and Priority and Blue Cross of Michigan, not Blue Care Network. I found that out last week. But I'm learning too. So here in Michigan, I am so excited to start meeting you and advocating for what a great service we have. What we have is we aren't just a vendor. We have an agent support program. So while we provide customer service and amazing customer service to your clients, what we really are is a support system to you as the agent. When you write a policy for somebody living with diabetes, your next call is going to be to ADS. It's going to be to me or my team to enroll them. You can do that at the point of sale. You should do that at the point of sale. You don't want to wait until your plan starts. Why is that? Because I have all that time to get the prescription, to verify their benefits, to get in touch, to create a relationship with them so that when their plan starts, it's a seamless transition. And you're not getting a call 2, 3, 4 weeks later. Where am I supposed to get my test strips from? Hey, I know I told you about those sensors and I'm out of them. Where am I supposed to get them from? All the things, all those questions that you get after the policy starts, if you set them up for success at the beginning of the process, then you don't have to worry about that after the fact, right? So who wants less phone calls? Who wants less questions about diabetes supplies, right? So we have the advanced diabetes advantage is what I'm calling it. I just labeled it that a couple days ago and I said, you know what? I like it. I like it because it is. You have an advantage. This is going to lead to better sales and better retention for you as the agent because this is one less obstacle that your client has to go through because you set them up for success from the beginning. So we're here to provide blood glucose monitors, right? So that's our standard test strips, glucometer, it's one touch, it's the AccuChecks, it's when you get diagnosed with diabetes, you have to test your blood sugar. Does not matter if you're type 1, does not matter if you're type 2. If you have diabetes, you need to know what your blood glucose level is at. Your doctor is going to prescribe, or their doctor is going to prescribe it testing once a day, every other day, up to 5 times a day, I've even seen. So it really depends on the disease state and how out of control the glucose levels are. Either way, you need a testing method. Blood glucose meters, BGM products, are covered in full by Medicare. It's a Part B benefit, 100% coverage. Your members should never be paying for a glucose monitor, and they should never be paying for test strips. And a lot of them are, because that's easier sometimes. Let's make it easy for them. Let's partner so that it's easy for them and they're spending less money, right? We also have continuous glucose monitors. And here's the X factor, which you probably don't know unless you've been getting my emails. I know some of you are like, oh yeah, I got your emails. I know your name, but I've never talked to you. So super excited to meet you in person. If a member is on insulin, they qualify for a continuous glucose meter. You've heard of those as the Libre, the Freestyle Libre. You've heard of them as the Dexcom. These are a needleless testing method. So it's a patch or a sensor that goes on the arm or on the belly, depending on the brand, and provides continuous readings back to a reader or smartphone. So for somebody who's on sliding scale insulin who has to prick their finger 5 times a day, every time they eat, they need to know how much to put in, to how much insulin to give themselves. They have to test. They need to know their meters. This time they're not having to prick their finger that many times. So what you don't realize is that Medicare has removed the requirements for testing and they require the requirements for injection times. So if somebody's on insulin, they can get a CGM. It's as easy as that. They don't have to be testing 3 times a day and injecting 4 times a day, and all those little requirements that were in there before are now removed. A lot of times with the diabetes diagnosis, there is not an authorization required. Sometimes there is, depending on your MA plans. A lot of times it's covered at 100%, especially with national carriers. The locals tend to have more of a coinsurance, but not all of them. Where is it? Dennis and I were looking up earlier, I think. Dennis? Yeah, we were looking earlier at some priority plans, and I found one that was 100% covered, one had a coinsurance. So these plans, but the bottom line is it's a covered benefit, right? And we have an internal financial assistance program for somebody who might still be on the line where they don't qualify for a DSNP, so they've got a coinsurance, but can't really afford that coinsurance. We have an internal program to help with that as well. So what is it? It's an advantage to you because when we call your member, we're going to use your name. Every time I talk to them, I'm going to tell them, Angela, Mrs. Jones, your insurance agent, Angela, sent me your information. So let's talk and set you up for supplies, right? So every time we talk to them, we're saying your name, reinforcing the relationship you've already built with them, leading to better retention, right? What questions do you have? Do I have a couple minutes for questions, Sunny? Okay. What questions do you have? Yes, sir. Yeah, it is. So we are a DME provider. We are a retail pharmacy. So that means we can bill Advantage plans, we can bill original Medicare, we can bill the supplement, we can bill the PDP. So we've been in business for about 20 plus years. We're out of Carlsbad, California, but I live here in Michigan. And we have dispensed the products from either Carlsbad, California, or our sister company, US Med, in Miami, Florida. So they come out of both depending on where the member lives and what their plan is. Yes, ma'am. From your lips to God's ears, right? So I would love to add more carriers. That is absolutely, we have a managed care team that is actively adding contracts. Michigan's been a tough market. Michigan's been a tough market, to be fair. Yes, ma'am. There's both. So the flyers I have now, so I have a couple flyers on my table if you stop by. This outlines, which one? This one outlines our program to you, the agent. This one teaches you how to get the information to me. And then I've got 2 customer facing flyers. Ideally, your workflow is you're sitting with the member and you've enrolled them in their new plan, and then you're going to call me next. Okay, Mrs. Jones, the next step we're going to do is we're going to call Laura over at ADS and enroll you in services, so there's no gap in coverage or a gap in service when you start. You're going to call me. My flyers currently have my information on them. When I run out of these, they go to a generic one. My voicemail has a phone number on there, an 877 number. So I answer when I can, but as you can imagine, I'm one person for all of Michigan and all of Ohio. So come AEP season, I am not able to answer the phone all the time. So yes, 100%. There's an 87. There's a Medicare number. It's specific to Medicare. They are used to agents calling. They are used to Medicare members calling saying my agent sent me. So these are a dedicated team. It's not my 300 customer service agents. It's like 10 people. They are for Medicare specifically. Yes, ma'am. Yep. Yeah, absolutely. So we're a national company. I personally manage Ohio and Michigan. So if you live in Ohio and Michigan, I'm your girl, no matter where your client lives. So if you have questions about plans locally, I have a grid. I can look it up. So I really look forward to working with all of you. I think, yes, ma'am. Oh, yeah. So Angela was a great proponent of ours, and she's used our services. So I was just going to give her a minute to just tell what kind of advantages have you seen with working with us?
So we'll be quick. Tell me if we got. But I had a big book of business in North Carolina, and their primary carriers that they work with were national carriers. So I worked with them a ton. But I will say, like, when you go in, you have a portal, so you log in, and you can do it while you're sitting with a member. You put in the client's, name, all their information. But the thing that I will say I probably love the most is they have a notes section. So, like, say I had a client that went by like a nickname. I would put in there, their nickname is such and such. When you call, you're going to hear this loud parrot in the background. His name's Tweety. And I would put all kinds of things that I learned that you can legally do this about them. And so when Laura or their team makes a phone call, I've been sitting in a member's house where, they will call within 24 to 48 hours. So I always save, you'll have the number. I would save it in my client's phone. So when it rang through, they knew exactly who was calling. So they answered the call. But I've been, at a client's house where I was back there 2 days later doing something, and their team called, and all the notes that you put in there, they have a very personal conversation. And we hear it over and over again that they do promote you. It's true. In my experience, you have a ton of diabetic clients. It's one of the best things that I've ever done for retention. And so, like, I'll take these flyers. I put, I have a magnet, so this goes on their refrigerator. They know who it is. But their numbers, I say the numbers in their phone. And so you do want to save it. You do want to save it in their phone. They'll think it's a spam call. But
Not at this time. No, we would have to be able to offer that service to every agent that we provide, which is, across the country. So so these are not the latest and greatest flyers. The new ones are, see, I don't need a microphone. We co-brand them with US Med. Thank you so much, Angela, and I appreciate your advocacy. Yeah, so we are now sister companies with US Med, so those are co-branded, and I co-brand with carriers once in a while. So but not with agents. So these are customer facing flyers. Ideally, once you enroll them, when you're there sitting down with them, you leave a flyer behind so they know who to follow up with. What I don't want you to do, and I'll tell you why, don't just leave this flyer with all the stuff that you leave behind, because they're never going to call and you're not going to get this just adds to their to-do list when you leave it with them and you leave it in their hands. You want to provide that service. I want to provide the service to you. You want to provide the service to them. Make the phone call right there or take the 30 seconds to fill it out online. So please stop by if you've got any questions. I also have these flyers for you to take home with you today. You will all get, as long as you were registered, you will get an email from me probably tomorrow that has all my electronic information, has these flyers electronically as well. And I can mail flyers to your offices. If you work with anybody else, let's set up a call and let's have 3 or 4 of us talk and just have some free time together. Okay. Thanks so much, Sonny.
Thank you, Laura. Okay, so I think lunch should be set up. Elena's lunch set up now or close? What? It's close. So get up and just crowd outside the door to put a little pressure on them. Does anybody oppose to doing 45 minutes for lunch versus an hour? Any oppositions? Awesome. If you guys get back sooner than 45, we'll get started sooner. Thanks a lot, guys. All right, everyone. Hope you guys enjoyed your lunch. We're going to prepare to have Jamie step up here and talk about Wellcare 2024. There's some caffeinated drinks in the back of the room if you need it. Hiding under the tablecloth. Are they for sure? I asked if they're also going to bring some coffee in too. We'll give them a few. All right, guys. We've got 95% of the people in here. So if you guys in the back would go ahead and grab your seat. Appreciate that. No one would get that. Although last year we had Duncan was here and they did the live broadcast and they also did some of the giveaways. He came up and did some games from Gull Lake. It's cool. All right, guys, we're gonna get going. Jamie with Wellcare is gonna talk about products from next year. Awesome. Thank you, Jamie.
All right, good afternoon. Okay, before I get into this, it's super cheesy, but I always like to ask, is anybody a CMU alum from Central? What? Man, I really am. I went to Central Michigan, graduated in 2020. I always just like to point that out, that I went here. So, but I'll go in and start my presentation. So my name is Jamie Custelut, and I am the Regional Agency Manager for Wellcare. I cover the entire state of Michigan right now. We are in the process of getting somebody on board. We just have, HR, that fun stuff to get through. So I should be getting some help soon. But right now it's just me. If you recognize Emily Lalonde, she is now the regional sales manager over 4 states. So she used to be another Michigan rep as well, but she kind of moved up a little bit. Still very active in the market, still have her support. She's really great. We have Kimberly Scott, who's our director over the central region. And then we have Karen, who's our account manager. So if you get emails from her, that's open them. And then lastly, on that bottom right corner is our Michigan Broker Support Shared Inbox. If you went to my table and grabbed a help sheet, it's actually on one of the sides at the top corner. This is an inbox that my entire team has. So, being the only rep right now, it's, really hard to keep up with phone calls, texts, emails. So this goes to that inbox. My whole team has it. they can see, oh, Jamie's, lagging behind because I'm not perfect, and we can get that answered for you. So try to utilize that if you can. Jumping right in to Wellcare. So Wellcare as a whole in 2024, kind of across the country, we really are kind of D-SNP focused. We know that that's like our strong suit. You'll see a lot of our D-SNP plans have put a lot of investments into them. I will talk about a couple of HMO plans too, and we have other plans as well. But really, it's just the D-SNP community. They're the ones that really do need us. We really do just excel in general with them. So this slide here just shows where we are as a national footprint. So we're in 37 states. So in 2024, we're adding Delaware. Woo, I don't know, selling Delaware. I also, as I bring up the D-SNPs a lot, I like to point out that fourth bullet point. We have over 400,000 D-SNP members, and I anticipate that to, continue to grow as we go into the new year. We have some really exciting plans. Again, I'm excited to get into them, and then, like I said, we do have plans, for the broader Medicare population. So on that help sheet there, or the booklet, if you grabbed it, goes over all of those. So if you don't see anything today that I cover, just ask me. We can go over that. One new thing that's going to be for the Michigan market is we are entering for 2024 a partial dual plan, so our all dual assure. This is new for Michigan as well as those other states up there. But this is going to be a plan that will have the same D-SNP-like benefits that our fully dual plans have. But, somebody who's on LIS, on a spend down, they can join this plan and still get really rich dental or supplemental benefits in general, like a D-SNP member. So Michigan, no expansion right now for 2024. We're still in 48 counties across the state. Providers, of course, our APP partners, Oak Street Health and Dedicated Senior Medical Center, are our strong provider partners. Really quick, I'll bring up the west side of the state. Wellcare is not that great in Kent County, Grand Rapids. Trinity Health is still out of network, and so is Spectrum. So just giving you an update there. Across, especially our D-SNP plans, we have really rich supplemental benefits for our dental. So we have one D-SNP plan right now in 2023 that has a no maximum allowance for dental. That's switching to a different D-SNP plan, but that's something that we're offering in 2024. So no maximum dollar allowance on one of our dual plans for dental, and that includes coverage for dentures and implants. So when I get to that, I'll dive in a little bit more about what that means. We have our new Wellcare Spendables card. Has anybody heard about that yet or looked into that? I'm really excited about that. Our Wellcare Spendables card, which I'll go into. This is our Flex card per se. So right now in 2023, we have a Visa Flex card through our vendor Wex Health, where our members can utilize that for extended dental, vision, and hearing services. So going into 2024, the Flex card is going away, and we're moving to Wellcare Spendables card. So I'll go into that a little bit more, but it's basically an all-in-one allowance card. So everybody, you kept saying, why don't you have groceries? Why is your OTC only with CVS? Well, we're changing that. We're going to an all-in-one. So I'll talk about that. And then this up here just goes into our service counties. In a couple of slides, I'm going to talk about the Ascension Complete transition to Wellcare. On your help sheet too, I did outline those service counties, and then you'll notice that there will be 3 Wellcare Complete plans. So when I talk about the transition, it'll make a little bit more sense. But our 3 Wellcare Complete plans are only going to be within those service or those counties that are on the bottom there. This is an overview of our 4 dual plans. So these are the 4 that I'm going to be talking about today. The top one, that Wellcare Complete Dual Access, big highlights on that. The Spendables card, which is our all-in-one benefit allowance, it has $180 every month. That is a rolling benefit. So I'll talk about that. We have dental allowances starting at $5,000 on our dual access HMO POS D-SNP plan. So just really great things. I'm going to dive into these more. And then this is our full 2024 MAPD product portfolio. So just in general, when you're doing your, I know the disclaimers that you guys have to do. For Wellcare in Michigan, we have 12 MAPD plans and 3 PDP. So that would include 15 plans for Wellcare if you're certified with us. All right, Ascension Complete. So how many of you work with Ascension Complete or know what that is? Okay, so Centene, who is our parent company, they owned 60% of Ascension Complete, and then we owned, or Ascension Complete owned 40% of themselves. So as of May 1st of this year, Centene acquired 100% ownership. So right now at the end of, or going into the rest of the year, or going into 2024, the Ascension Complete brand is going away. It's going just through a brand transition. So that's just really going to include like logos, the website, like nothing is changing as far as like the provider network, the service area. It'll still operate as if it's Ascension Complete. So that'll still be an option. So this just kind of, I'm visual. I like to see things. It should also be on your help sheet too. But you'll notice that the brand name is Ascension Complete. That'll switch over to Wellcare by Allwell. So that's the logo that'll be used. The plan names will be switching from Ascension Complete to Wellcare Complete. So that'll be a little indicator for you to know that it's a Ascension Complete plan. And then of course, I said the logos. And then big thing is the website. So when you're going to wellcare.com, oh, thank you. When you go to wellcare.com, that's where you kind of go through your, or if you want to send through like find a provider, stuff like that. So when you do Wellcare Complete plans, you're going to want to make sure that you go to wellcarecomplete.com. So there are 6 plans right now for Ascension Complete in Michigan. So I kind of staggered them. The top 2 are going to be those dual plans, or just kidding. Those are going to be the give back plans. Those 2 plans will either crosswalk or just rebrand over into that Wellcare Complete plan. I do have this on the help sheet too. So it's just basically consolidating down to 3 plans. Now, if you have members that are with Ascension Complete right now, there's no extra step they have to take. They'll be automatically crosswalked into those plans. So it's really just us trying to get ahead of this brand transition. So, they're not losing coverage. You're not losing your book. It's just a brand transition. All right, Wellcare Spendables. So this is something that we're really excited to have in 2024. So like I said, the Flex card is going away at the end of the year, but we're introducing the Spendables card. So this is an all-in-one card. It has a single allowance that members can utilize, well, especially our decent members, they can utilize it towards, of course, dental, vision, and hearing if they choose to do so over their allowances. They can also use it to get groceries. They can get utility and rental assistance. They can also do gas pay at the pump as well. So just a lot of different options that they can utilize that for. And again, that's a single allowance, and it is a rolling benefit on our decent plans. So the way that the spendable card works is Solutran is our national or is our vendor for this for the spendables card. So when it comes to groceries and OTC, it runs off of a national retailer network. So, that's going to be Kroger, CVS, Dollar General, Rite Aid, Save-A-Lot. OTC is not going to be exclusive anymore to CVS. It'll be, again, a part of that retailer network. They can still go to CVS if they choose to do so, which my mom does not like CVS, and I had to get her to do the delivery, which, again, she did not like either. But so I'm really excited to expand on that. But then when we get into gas pay at the pump, again, it's pay at the pump. So if they try to go inside and put $20 down on pump 10, it's going to decline. So utility and rental assistance, in a couple slides, I'll get into how that really works. Just a little overview of those categories. So food benefits, this is going to be healthy foods. Members or our decent members are going to get a OTC and grocery catalog. So again, it runs off of a national or a retail network. So they can go to Kroger and get groceries. They can go, if they want to go to CVS or something like that, they can do that. But they'll get a OTC and healthy food catalog that will outline the different things that they can get and whatnot. So I have that in a couple of slides. But over-the-counter items, that's pretty self-explanatory. Utility benefits and rent assistance. So they can pay their rent, utilities straight up. They can do it, of course, the app, online, or they can call in. I have on the last slide about the spendables. They will have a dedicated onshore customer support for the spendables card. It's not Wellcare customer support. Don't worry. It's a different customer support. But they can call in and say, like, if they have a piece of paper in front of them that has their utility bill and they have no idea what to do, they can call into a rep and they can walk them through and process that over the phone for them. So definitely really easy to do that. They, of course, can utilize it towards dental, vision, and hearing services. So right now in 2023, our Visa Flex card, you can use it to extend dental, vision, and hearing allowance amounts. So this can also, be used if they choose to do so. And then lastly, gas pay at the pump. Like I said, pay at the pump. I'm gonna say it so many times, it'll probably get annoying. Pay at the pump. Sounds good. And y'all are quiet. It's lunch, right? Okay. I know I'm not a very energetic person, so maybe next time I should go in the morning. All right. Again, just going a little bit more in depth into those categories of healthy foods, over the counter, and the additional dental, vision, and hearing. So when members again get, I kind of like to jump around. So again, they'll get their OTC and healthy food catalog in the card. They'll get a welcome kit. They'll get their card as well. So they can utilize that through any of these. With the Wellcare Spendables, they also will have an app. So if they're going in the grocery store and they want to utilize and get, groceries, in the app, there's a barcode scanner. So they can go throughout the store, scan a barcode, see if it's applicable or not. So they don't have to, worry about getting to the register and it not being covered. But then also if they go into the store, this is an issue right now that we have with our food card right now in 2023. But when they go to the store and they decide to get ice cream or a 6-pack and put it all on one, as it gets scanned through, they'll scan everything. They'll scan their, spendables card and it'll just take off the allowance of what is applicable. So it's not going to get declined. They're not going to get embarrassed, of why that would happen. So just keep that in mind that it'll take it off. I'm gonna jump back to the beginning for a second. I also want to point out the backside of the spendables card. So if they were to go to somewhere where they can't swipe the card, so that mag stripe that's on the top, they can actually scan the barcode as well. So that's another option too, if a place doesn't have something where you can scan it or swipe it. All right, this goes into the utility rental assistance, gas pay at the pump, and dental, vision, and hearing. So that the way that this works is off of the point of sale system or merchant category codes that a credit card system would have. So like when you go to a dental office and they go ahead and swipe that card, it comes up as a dental provider. The same thing if they go to a vision provider, it'll come up as a vision. So they have to go to places that will accept those codes. For example, if they try to, they want to get a pair of glasses, but they try to go to the Walmart Vision Center, that comes up as retail, so it would get declined. I'm still waiting on clarity if there's going to be, well, I'm sure there will be, but on how a reimbursement process will work. So I don't know about that right now, but I'll make sure to get that with Sunny. And then point out with the gas, like I said, it is pay at the pump. So the merchant category code that pumps have are different from the inside. So inside will have a retail code. So that's why they need to go at the pump. When they get their card, they're going to make sure they activate it. So they can do that by phone, by the mobile app, and go online. They will not have a PIN. It will just run as a debit or a credit. So they don't have to worry about getting a PIN set up. This just is a snapshot of the online portal and also the app, so they can go ahead and follow their allowance, see how much they have left. They can go ahead and see what they've used it on, those receipts. Very easy, friendly to go through. They can shop online too, order new cards, see the catalog. Yes. Receipt, what do you mean? Like,
Something that says, okay, you just used $800, you have this amount left on your. Do they get that?
oh, I don't know if actually on the receipt from the place. They can call into that call center for the that the spendables will have. They can call in there and say, hey, what's my allowance? Or if they had a transaction somewhere, hey, do you remember how much I paid or what store I went to? They can pull that up too. And this just outlines a little bit more of the retail networks. I did just this morning get a list from Emily of more independent retailers across the state. Like Save a Lot came up, H Mart in Troy came up. So I'll get that to Sunny of the more independent retailers, but those big ones will be, Kroger, Walgreens, Walmart, CVS. I also want to point out Mom's Meals. So that is our chronic and post-acute vendor, one of the vendors that we use for meals. But decent members with their Spendables card, they can actually use it on Mom's Meals if they want to do so for healthy food. So I think that's a really good partnership to have, especially if those members don't want to go out, and they want those meals already made, they can go ahead and utilize that. And then kind of just to wrap up Spendables, it is a trademark name, Wellcare Spendables. I think that's really going to be good for us going into 2024. I mean, a lot of carriers have a flex card, which Wellcare was the first one to come out with it years ago. We only utilized it for dental, vision, and hearing, but now you have all these carriers doing, maybe it's food, maybe it's OTC, and we had brokers go, well, why isn't your flex card like that? So that's why we kind of moved towards the Spendables card, and that's what it's going to be for us. All right, jumping into MAPD supplemental benefits. So our Wellcare Spendables card, like I said, is through our vendor Salutran. Our dental vendor is going to be DentaQuest. So that network, also on your help sheet, I did include different contact information or like phone numbers or email addresses that for the different vendors. But with DentaQuest, we'll have packages that'll have, your routine exams all the way to $5,000 for an allowance and coverage. For vision, our vendor is going to be Premier Eye Care, so that's the same right now in 2023. Again, those packages will have routine exams all the way to allowances from $100 to $600, and they can utilize that allowance to get as many pairs of glasses as they want, as many contacts as they want, up until their allowable max. So they don't have any restrictions with that. And then lastly on this slide, we have hearing. That is through our vendor Hearing Care Solutions. Again, some plans will have routine exams all the way up to hearing allowances, which will range from $350 per ear up to $2,500 per ear.
Is that a change for 2023 or is that the same?
It's the same, but I believe it's different from Ascension Complete, if I'm not mistaken. But DentaQuest we use for Wellcare right now in 2023. With hearing, or I think I was done on hearing. I'll just move on. Okay. If you have hearing questions, ask me. First one on here is our non-emergency medical transportation. That's through our vendor MotiveCare. So MotiveCare has their own type of rideshare program, but they also contract with Uber and Lyft. So some of the plans will have 12 one-way trips up into one of our decent plans has an unlimited trips every year embedded straight in the plan. So I'll talk about that in a little bit. Fitness, that's through Silver and Fit. So all of our plans have that. Of course, $0 membership at any of those gyms. They can also do those in-home kits. So if they want to get, a walking cane, if they want to get a Fitbit, there's, different options that they can utilize. Below that, we have our PERS, or Personal Emergency Response System. I don't see Javon in here, but he took my line. It's I fall and I can't get up. I just said that 2 days ago, and you watch me say that. But that's through PERS and that's through VRI, which they are owned by MotiveCare, so they work hand in hand together. And just to point out, with the PERS, it doesn't have to be somebody who's just bound to their home. If there's somebody is out in the community and they're very active and they just want an extra level of, protection or safety, they can do that as well. Second to last one on here is our meals. So I said this before, Mom's Meals is one of them, and then GA Foods. I believe our plans have 42 meals after discharge. So that can be for chronic, post-acute, and/or nutritional shakes. Lastly on here, we have our in-home support, and that is through our vendor Health Align. So we don't partner with Pop-Up Pals. So I know a couple carriers do that. So this is not what that is. But it has chores and personal care services depending on the plan. And that will have 6 to 24 visits per year. Those come in 2-hour increments, helping people clean up their house, vacuum, take out the trash, whatever they may need. Telehealth, that's through our vendor Teladoc. And I like to bring up Teladoc because if you have a beneficiary or a member on a non-DSNP plan, and let's say it has like a $35 specialist copay, if they go see a specialist via telehealth and their specialist or that provider utilizes Teladoc as their telehealth service, the copay will be reduced down to $0. If they go through like their provider and it's not through Teladoc, they can't come back. We won't reimburse them for that. It has to be through Teladoc. So just if they ask about that, make sure that's communicated. And then those last ones on here, the nursing hotline, the routine acupuncture, chiropractic, podiatry, that can all be activated by the member calling into member services to get those benefits, and then they can kind of direct them from there on how to get that. All right, jumping right into the plan. So like I said, I'm going to go over the 4 DSNP plans really quick, and then I'm going to go over 2 HMOs. So first is our PPO DSNP plan. This plan right now is offered in 2023 for Wellcare. So this plan, I'll just start out with those little highlights. So it has $155 every month on that Wellcare Spendables card. So again, they can utilize that for groceries, OTC, gas pay at the pump, rent, utilities. And it is a rolling benefit. So if they don't want to use it for 6 months, it can add up as much as they want. If they want to use the whole allowance all year just by buying groceries, they can do that. If they want to use it just on gas, they can do that. There's no separate purses for those DSNP members. The plan has $4,000 in comprehensive dental services or allowance, and that includes coverage for those dentures. A $500 allowance for eyewear, and $4,000 in allowance for hearing aids. So the third line from the bottom on there, it says $2,000 both ears every year for the hearing aids. It really means per ear. I don't know why it's said like that. I think it's very confusing. But on the help sheet, I made it a little bit easier so you can see that. And then another thing to mention, just in general about our DSNP plans, even our partial dual plan that we'll have, it has a $0 copay on all prescription drugs, any tier level, brand generic. As long as it's in the formulary, they'll get $0. So that's really crucial, especially if they're on the that partial dual plan. It doesn't go off of LIS or that structure. It'll just be $0 if they're on that plan. And then, of course, just, with a PPO plan, if they don't have those doctors in network, this is going to be an option they can look at versus the HMO DSNP plans that we have. But first is our Wellcare Dual Access HMO POS DSNP plan. This is one right now we have in 2023. This plan has $134 every month in that Wellcare Spendables card, and it is a rolling benefit. So again, all those different things that they can utilize it on, they can, however they choose to do so. This plan does have $5,000 in comprehensive dental allowance, including coverage for dentures. So right now in 2023, this specific plan has an unlimited dollar allowance for comprehensive services, including coverage for dentures and implants. I believe it's the next plan that I show you, which is another HMO decent plan. That one has the unlimited balance or unlimited amount. So if you have members on this plan right now that, really utilize that dental benefit, that will kind of change and it will, move to a cap. So just make sure you're aware of that. It has $400 in the eyewear allowance, $3,000 for those 2 hearing aids. The PERS, 24 one-way trips and transportation every year. Again, just $0 copay on those prescription drugs. All right, this is, well, I can't say this beneficiaries, but this is my favorite plan that we have right now for coming for 2024. So this is our Wellcare Complete dual access HMO decent plan. So Wellcare Complete, remember it's going to be that smaller service area. It's going to be that Ascension Complete provider network. So this decent plan, start right off at the top. It has $180 every month in the Spendables card, and it is rolling again. So that's a little over $2,100 for the year that member is getting back in their pocket. I mentioned the dental on that previous plan. So this plan going into 2024 will have a no maximum allowance for dental services, including coverage for dentures and implants. So what that means is there's no dollar amount that the member has to remain under. We will cover whatever amount as long as, of course, it's approved by prior auth. There will be benefit limitations like dental plans have. Like they can't get 5 pairs of dentures if they want. They can't get, a whole mouth of implants. I don't know who would do that. But if they're, trying to decide between getting a root canal, getting a filling, getting an implant, if they have a dollar amount cap, they kind of have to prioritize what they want to get. And so with this, it allows them to not have to do that. They can get what they need right there. Well, if it's approved. I believe with implants as a limitation, it's 2 per year, I want to say. But when we get our evidence of coverage, it'll come with dental reference codes that each plan will have, and it'll say the specific code and that procedure thing that it would cover. So as long as it just has to be approved. But yes, it could, if they rack up 20 grand and it's all approved, of course. The plan has $400 in that eyewear, $3,000 for those hearing aids. And then again, I mentioned the unlimited transportation. So that's on this plan. So that's for non-emergency medical transportation. They can go to the pharmacy, the doctor's office. That's unlimited, straight in the plan. So they can go ahead and utilize that as much as they want. Yeah, and then lastly, just the $0 copay on all of those drugs. So I think this is going to be a plan that a lot of members or a lot of beneficiaries are going to be attracted to. So just keep in mind, it does have a smaller network. It does have a smaller service area. It'll have a different formulary compared to the other plans. So just make sure you're keeping that in mind or looking at that. And then lastly, our all dual assure or that partial dual plan. So again, this has DSNP-like benefits that those LIS members may not typically get. So they receive all of these benefits that are on here. So where is it? The Spendables has $51 every month and it is rolling. So a little over $600 for the year. And they can use that for, the groceries, the OTC, what have you. Still really high in dental. It has a $4,000 dental allowance, including coverage for those dentures, $300 for the eyewear, $3,000 for the hearing aids. Again, like when people are going through Medicaid redetermination, I know that's a big thing right now, still going on for the next year or so. Maybe, a fully dual person lost a certain level of Medicaid. This kind of helps them or could be a good option for them to still get those DSNP-like benefits. All right. Last 2 plans that I'll go over are going to be our Wellcare Complete plans. So we have, the dual plan that we went over. So this one is our Wellcare Complete no premium HMO plan. First off, I do want to start with the dental. So this is a HMO plan, and it has a no maximum allowance for dental for comprehensive services, including coverage for dentures and implants, but it does have a 30% cost share with it. So the decent member didn't have a cost share or copay on an HMO plan, they will have a 30% cost share. I'm not going to do fast math, but 10% they rack up, 30%. I don't know the math. That makes sense. So for the Spendables card, this plan only has OTC and or dental vision and hearing services. It is rolling. So if you notice some of the non-decent plans, they'll either be just OTC or OTC and or dental vision and hearing services. Some of the plans may not be rolling, some may be. So I did indicate that on the help sheet if it was rolling for that plan or if it was not. And I believe on the help sheet, there's 2 plans actually that did do an increase for our Spendables card. And that was actually this plan, it did go up to $77 a month. So it did go up $10. Come on. All right. And then lastly, the plan I'll go over is our Wellcare Complete Give Back HMO plan. So we have 3 give back plans going into 2023 or into 2024. 2 Wellcare ones, but this is going to be the Wellcare Complete one. I'm trying to see what the give back was. 150. Oh, it went up to 156. So it's a 156 give back Part B every month. For dental, it just has preventative services that are covered. For the Spendables card, it has, sorry, I should have wrote this down. $40 a quarter non-rolling, and that's for OTC items, so keep that in mind. $100 for the eyewear. So I think the biggest thing on, this plan is if you have somebody, really who is just looking to get the Part B. Our other 2 plans that we have, one is a $111 give back and one is a $75 give back. So those will have a little bit higher supplemental benefits, but this will be a good plan to have the Part B give back. All right. How many of you sell our PDP? Probably a decent amount. Okay. So there were changes with PDP. One, I don't have premiums yet. I keep bugging Emily to see when we get those. I did kind of go through all of these and look at last year's versus this year's. So I'll just kind of call out the value script. I know that that's the most popular one. In 2023, when we look at the preferred retail amounts, so in 2023, one thing that's changing is tier 3, it was at $44, so it's now a 25% coinsurance. And then when it comes to standard, in 2023, tier 1 had $8, tier 2 had $15, and tier 3 had $47. So those are changing. So again, I'm just waiting back for those premiums. Does anyone have questions about PDP? I normally don't go too in depth to them, but. So with PDP, if you listen to anything that I say today, please pay attention just, to this. And I say this every time because it is important. Our pharmacy benefits manager, our PBM, is changing from CVS to Express Scripts starting January 1st of 2024. So what this means is members are going to get a new ID card, especially PDP members. So PDP members are not expecting a new card, but they're going to get a new one because of that PBM transition. And that's more of the stuff on the back end, the back end of things. So there's not much that they have to worry about. It'll automatically switch over if they have open prescriptions to Express Scripts. And it'll come, the ID cards are going to come into a teal envelope, just like our logo. So again, just trying to get ahead, make sure that, if you get calls of somebody getting a new card, it's okay. It's just because the backhand benefits manager is changing. So they need that new card to be able to access their prescription. So make sure they utilize that. And then lastly, that also is going to impact our mail order. So Express Scripts is going to take over for the mail order. So right now in 2023, it is CVS Caremark. So going into 2024, CVS Caremark is going to be out of network as our preferred mail order, and it'll be Express Scripts. If members are utilizing mail order right now with CVS Caremark, it'll automatically transition, or their open prescriptions will transition over to Express Scripts, so they don't have to have their provider, whoever's prescribing, like switch that or send it or mess with that. That'll automatically transition over. The only thing that they would need to do is set up an account online under Express Scripts. And then, of course, if new members want to utilize that, make sure they sign up with Express Scripts for 2024. And they're going to have their own call center to support members too. So not Wellcare. Materials. Just want to highlight a couple of these options or different materials that we have for 2024. So our enrollment guides are getting a new look. Our welcome back kits are getting a new look. MAPD members only are going to get the welcome kit or the welcome back kit. PDP members will not. Just keep that in mind. But it'll go over a lot more stuff like vendor contact information, the spendables card especially. And then in the back of those booklets, they're going to have a little bit more of a tools section. So showing members, how to use a QR code, where they can access videos and go over the different benefits. Kind of like how UHC did this morning. So different things like that. And we did go through our pre-order phase right now. So 4T did get a pre-order amount. So once you get, if you can go to Sunny and get materials if you're with him, or order once you're certified. Broker experience enhancements. This is my favorite part. So I know customer service sucks. I get it. I know it's not the best with Wellcare. I do hope you're seeing improvements. You'll notice that we're not really expanding in 2024, kind of across the board, and that's because we need to clean up our broker support, our member services. We can have really great plans, really high benefits, but if you can't use it, then there's kind of no point. So we are getting better with that. And again, if you have negative experiences, especially with Wellcare, which I'm sure you guys do, if you're on the phone, try to get an interaction ID at the end of that call. Send that over to me. If you don't get that ID, send me the number you called off of and the time. I send that to our to that team who handles that. They figure out, who that rep was that called, if they need to be retrained. I'm your biggest advocate. I'm not a corporate person, even though I work for a corporation. I want to know what's bad because I want to make it better. So, call me with the good stuff, but please call me with the bad stuff because I do want to know. And so, with the investments and with stuff getting, a little bit better, I think the biggest thing I just like to call out is our survey satisfaction, or the customer satisfaction survey score. So in 2022, it was only at about 85%. So right now, year to date, it is up to 93. So that's really good. Broker support is all on shore, and customer service is still in a hybrid model. Hopefully, we do see improvements with that. Centene Workbench. So if you have been in Centene Workbench lately, has anybody noticed you can download or view the ID cards for members? So if you go in your book of business and you click on that and go on the left column, you'll see a little ID box with a little guy in it. So if you click on that, you can actually view the member's ID card, the front and back. You can print it off a PDF. You can send it to them. So you don't have to call in anymore, ask what the member ID number is, all that stuff. So, another thing with feedback, if you have suggestions for how Workbench could improve, or if there's something or a feature that you're like, oh, this would be beneficial, let me know. I know the person who actually works directly on that, one of our VPs. So we're always providing them with feedback on what could get better. Enrollment options, of course, we have Ascend and paper applications, but I want to point out the Pearl. So if you go to wellcarerep.com/your NPN, anybody who's contracted with us, it has this, pops up with your name, your phone number. It also has a link where somebody can enroll. So this is a non-agent assisted platform. But if somebody enrolls through your Pearl, through your link, you'll get credit and you'll be the agent of record. So with with scopes coming out and that whole thing, if somebody goes and does this process, you don't got to get the scope. Again, it's non-agent assisted though, so. All right, BBEs or HRAs. So, that's that questionnaire that they complete at the end of an application. So for Wellcare, if you complete a DSNP application, you'll get, or complete a BBE for a DSNP member, you get a $225 administrative payment. And then if you do a non-DSNP, it'll be $75. This is active right now as well. And then, keep in mind when you're going through AEP, you're getting people for 1/1 effective. You're not getting that payout right away. These, even through AEP, will pay out weekly, even for a 1/1 effective member. So that's $225 per DSNP application. So really take advantage of that. I mean, best practice is to, hello, okay. Best practice is to, kind of do it right away. People say, within 30 days. I say do it right away, and that's just because, if a couple days go by, Wellcare internally might, reach out and do that themselves. So then you can go back and get credit. So try to do that as soon as you can if you want that payment. All right, certification. Big thing about certification is, we had, some issues last year about signing the certification contract or recertification contract. So once you complete AHIP and complete our ACT training, which is in Centene Learning Center, and that link can be accessed within your Centene Workbench portal right on your dashboard. But once you complete AHIP and your exam, you'll want to sign your recertification contract. So on your dashboard, there'll be a big red X that says, hey, you need to complete this. We had a decent amount of issues last year where people were getting emails saying, hey, it says I'm not ready to sell. I did my exam. I did AHIP. You need to sign this contract or your recertification contract. So if you're getting emails about not being ready to sell and you did the exam, this is probably why. All right. And then if you read Wellcare emails, which you should, but I know everybody doesn't, biggest one, just pay attention to broker bulletins. That comes from our national team, the corporate side. So commission updates, SEPs, Custom Point, which is our material ordering system, all that stuff. So make sure you pay attention to that. Of course, look at the other ones too. They're very helpful. And then I'll leave this slide up because this is actually going to be my last slide, but this is just some, broker support resources for you. Just the top one, that broker support. But of course, the paper applications. You can call into our SPOT for eligibility. You can do a telephonic SOA. Oh, I forgot. No. I forgot what I was going to say. All right. But that's it for me. Thank you. If you have any questions or if anybody has any now, or you can come meet me back at the table, I'll definitely answer those. But thanks for putting up with me and listening to me. Appreciate it. No, you're in the room.
All right. Well, thank you very much, Jamie. All right, quickly, we had that raffle for those people that went to YouTube and followed our page. We're going to do that raffle now quickly while Angela, you and your team come up. Awesome. Have Ken pull it.
All right, Ken.
All right. It's Sunny Gurney again.
It's Nancy Lentine.
And she's not here. That's okay. You don't have to be present to win. I said that a couple times. Sorry, but I do have the $100 in my pocket, so we'll see. Yes. So I'm not sure if Nancy's watching online or not. So Just for you guys to know, I know that we did announce it for those of you that are online. Please put your name and your NP on there so you get credit for attending the Aetna presentation. So Angela Hauser and I go back about 10 years, and I'm happy. What's that? All right. Yes. We were young kids 10 years ago. Anyway, so I'm excited about Aetna's plans to see what this is for 2024. Don't everybody just pack up and leave. Just stick around, say hello, goodbyes, and everything. So, Angela and Dan, are you guys cross presenting? Okay.
I will wander aimlessly.
All right, can everybody hear us okay?
Can you hear me?
All right. Good.
Like I'm yelling at my children.
Hey, it's nice to meet everybody this, past 24 hours here. My name's Dan Staub. I'm new to the market. I'm not new to Aetna.
So we don't call him New Dan?
Not new Dan.
Not New Dan, but
Yep.
you're New Dan?
I think this is maybe my 13th AEP. I'm down in Indianapolis. I handle Northeast Indiana and now Southeast Michigan, sharing that with Renita. She's down in Detroit as well. But we're happy to be here. It's new to it's nice to meet new faces to names I've seen. So thanks for having us. We have an entire team here in the Great Lakes for Michigan. I know not everybody could be here. A lot of our team's actually out at a conference right now.
So we want to thank Sunny for getting me out of going to Florida this week because I don't like it. And it was the only reason we didn't have to go to Florida.
Yes, thank you.
Thank you, Sunny. All right, so this is our Michigan sales team. I'm actually Illinois and Wisconsin, but I'm transitioning Jack Cohen, who's in the middle at the bottom. He is the sales manager that we take in Michigan and Indiana, but we promoted him. He still has a territory, so you're probably stuck with me for a little while, but I think Sunny thinks that's okay. Ryan Turkleski. So, if you go in the MIT, so the entire side of the MIT all the way up to the UP is Ryan Turkleski. And then Dan and Renita share Southeast. And then the bald guy at the top, that's a really old picture, but he's never changed the way he looks since I've met him, as our director, Todd Brooks. And then Mark Stiglitz is our CMO of Medicare. So this is just the sales team that handles Michigan. I wasn't done. And this is the sales team that handles Michigan. We have an internal support team, retention specialists, CLGs. We're broker only in most of our areas. So we have an entire 2-page slide I won't bore you with because it's the end of the day and you guys are sick of us, of people who support our broker sales force in the market. Go ahead. I'm not driving, so.
Okay, so let's get into it. We put together a lot of these products, benefits. A lot of this is right off the press, guys. So we went into NAMBA and we came out with additional funds. So a lot of the first looks you've seen online have gotten even better. We've added a lot of things to different areas. So stay with me here. There's a lot of information.
We promise we will not read you the slides. We'll tell you the important information. Then Sunny will make sure I have all your information and we'll email it to you. You're welcome. It's the end of the day. I'm not boring, I know.
Well, you're getting it first. This is the first MST in the market too. So you guys get this right off the press. We don't even have it printed yet. So
Technically, we're not approved to start them till Monday, but I'm more of an ask forgiveness than permission kind of girl. Those of you who know me, nobody is surprised by that statement, right? Okay, so let's get into it. So what's the difference with that now? Stable plans. If you are expecting us to come out with something crazy and on fire and shiny that's not sustainable, we're not that carrier. We're never going to be. We're not going to come out with some crazy thing that you can only use when the stars align on a Tuesday in the month of June. We're not going to do that. We're going to be stable products. They're going to get better year over year. We're going to make it easier for your members. That's how we function. So stable or improving plans, because NAMBA. Does everybody know what NAMBA is? It's the National Part D information. So we get that after we send our bids in. And so it's our best guess until we get those. So we are actuarially guessing. Educated guess. We have people much smarter than me because 4 out of 3 Americans can't do math. Me too. So we have people for that. So they sent NAMBA back and we had huge enhancements. So you're going to see, if you look at our first looks, most of our plans got better after that. So it's pretty cool. What you're gonna see is this acronym in purple. I say it all the time. I literally have a one-liner for almost everything, and I'm sorry if you don't think I'm funny. I think I'm hilarious. We call it WYSIWYG. It's what you see is what you get with extras. So WYSIWYG, you guys can quote it. It's an Angieism, and because there's no smoke and mirrors, there's no you can only go to this network. We kept it really simple. So we gave you extras that you can use without having to do any guesswork for your clients. We want it to be easy for you, but more importantly, we want it to be easy for your clients. I mean, so that's a big thing. $0 PCP, no medical deductibles, pretty standard stuff. We don't copay stack. I know we talked to Ken last night, and he was telling us that eye injections were so much cheaper. How are they cheaper? Because the diagnostic copay was cheaper than the 20%. You only pay one. So, those things do come up. Really, again, protecting the member. Our national network is on our HMO and PPO. There's no guesswork. Unless the network is something where it's a medical partner or it says Prime in the name, right? Got it? And you guys don't have a lot of that. Some of you saw in some of my other areas that do. Those networks are different because they're high performance networks that coordinate with a provider group. Makes sense, right? Everything else is national. You don't have to ask for permission. You don't have to do anything crazy. Look online, they're a network. It's just that simple. Okay, so and we also have flat copays for some of our common out of network services. Sometimes people just want a second opinion. They want to go to that other doctor. Happens all the time. So PCP, labs, specialists are going to have flat copays on all of our PPOs in or out of network. It doesn't matter. Okay. Care management. So this is probably one of my favorite topics. One of the things we do and we've done for years is we have a care management program. You don't have to do anything. So hopefully you're doing the HRA when you enroll your people digitally because you get more money, right? Yes? No? Yes. This is an interactive class. Okay, end of the day. Okay, so you do the HRA. That's not medical information from a provider, right? It comes from the client. What does that do? So you have 2 lanes. You have like the express lane, then you have like the normal lane where we're waiting for them to put a claim in. Well, if you do an HRA and you say you have diabetes, you're self-attesting. So what we're going to do is we're going to put you in the express lane to work with our care management team or get an in-home assessment. Why? So we can find out what's going on with you quicker because we have case management for diabetes, COPD, asthma, chronic heart failure, things like that. Then we also have advanced care programs that are not claims, they are claims based, but they're not for just 4 conditions where we have 17 different conditions with a specialty nurse team that only works with 1 condition. So I have multiple sclerosis. I'm very open about it. Nobody say oh because I don't care. I do. I have it's called an accordant nurse. She works with that disease. Her entire team, and I say ladies, but we have male nurses too. My team is women. They only work with 1 disease. You know what that means? Pardon my French, they're a hell of a lot smarter than I am about that stuff. I work in this. I think I'm pretty well versed. I learn something from her every time I talk to her. It's free service because when you have those kind of chronic conditions, they're never going away. They will develop and get worse over time. So that nurse is strictly free of charge, works specifically with 1 disease for that member. It's just something that we do that you may hear about from your clients. A nurse called me. Well, okay. We're not going to tell you it's HIPAA, but you should know that it's happening because those things happen behind the scenes all the time, which is why our retention rate is in the high 90s. Other cool things. I always hear about transportation. We have it on Decent. We'll talk about that in a little while. So if you have a client that needs a benefit above and beyond Medicare, what do? Senior center can't help them. You can't find it. We have concierge services. We've had it for about 8 years. This is a team within Aetna. This is all they do. It's called Resources for Living. It was about 50 people. It's about 65 right now. It's growing. You can call them as a broker. Your member can call them or whoever their person is, son, daughter, whoever's helping them with their care. It's not HIPAA. It's not medical. They will help find services. Think of them like your own personal Angie's List, right? They're going to go do the research. They'll call you back. Say, hey, Ken, we know your client needs this. I couldn't find that in your area, but you know what I found instead? And help align them with services. We're not paying for those services. Sometimes it's just finding if there's a program or something that can help them and if it's available. Transportation is something that people don't always have on their plan. Maybe there's a public transportation program. Maybe there's somebody that can help them with some kind of service. It was really big during COVID. People who were stuck at home needed daycare, but it wasn't medical. Medicare doesn't cover that, right? Their loved ones can't do it. Facilities are closed. What do? Helping them find those types of services. So if you have questions on that, we have a whole flyer. There's a guide you can take. There's actually a flyer you can personalize with your information for your clients that talks all about it. Some of our plans have a medical wrap card. We'll talk about that in a little bit. Extra benefits card in some of the plans. Again, he'll get into all that. On all of our non-DSNP plans, we added a fitness DMR. The heck is DMR? We like those 3-letter acronyms. DMR, direct member reimbursement. So think about people's lifestyle, healthy members. Let's say they need fitness equipment, yoga mats, running shoes. They want to go to a national park and go hiking, and they have to pay an admission.
Fishing rods.
Fishing rods. Look at that Wisconsin guy over there. Right?
incredible.
So this is allowance, an annual allowance they can use for services like that. Direct member reimbursement, really trying to help them stay active and stay healthy. We'll get them a Band-Aid and help deal with any medical issues. That's our job. We all know that. That's where healthcare comes in. But what about keeping them healthy and active before they need it? So that's on all of our non-DSNP plans. Enhanced formulary, and then our network has enhanced again with the addition of Spectrum and Bronson.
Awesome. Yeah, so there's a lot of support here as we went over in the market. What we're here to do is go over a lot of these things that really set us apart. You've got multiple resources, whether it's retention, community engagements, your sales and service. We do have a front runners program. And thank you to anybody in the room that's qualified for that status. It's kind of our elite agents. You're earning points by doing business with us. That's partnering with us, and we can give back to you a little bit more. I talked about the team of community engagements. We have retail options. I think a lot of people lost some Walmarts this year and have been looking for alternatives. We do CVS year round. It's a big opportunity. It's a little bit different here in the Midwest. We have a lot of CVS locations. That brand equity goes a long way, and filling in some of those areas, creating those relationships with the pharmacy, getting referrals is a big part of growing your book of business.
And the thing on retail, if you guys are doing that, there's no big fee to do it. So that's always the question we get. We don't charge any. There's no commas in the amounts. There's nothing like that. It's not. You do have to buy a retail kit. It's like a pop-up table and some materials to go in it that are compliant. Yeah, you have to have compliant materials to do an event. I mean, I feel like we all know that, right? But it's not $1,500. It's not $1,000. It's $200 for a kit, and then you get whatever materials you want to go in it. And we don't allow more than one Aetna agent in any location. So if you're the Aetna agent in a location, it's your location until you pull out, unless you come out of it. You could share, like you have a business partner and you're like, I want to work with Dan today. Cool. You guys can tell us that and we will let you do that. But we're going to protect that store and that relationship for you.
Yeah, and that's year round as well. Raise your hand. Does anybody staff retail or have or currently? Couple? Okay. Well, follow up with your broker manager. You'll get our details, but if that's something you're interested in learning more about, we can go through it. So I know I took over Southeast Michigan this summer, stepped in.
June 1st.
What's that? May 1st? June 1st?
June 1st.
Who's receiving my communications? Who's in Southeast Michigan? I know I send out a Medicare Monday every Monday, so check those out. There's a lot of good information. What we're really trying to do is streamline a lot of the different tools and resources we have for you and make it easy getting it to you. And that's on-demand trainings. I do slide broadcasts. If we're doing an event or if time crunch, something coming up that's important, and I want to remind you, I'm sending out those communications, but really getting you all the information. You can't come to every training. We're all busy. AEP gets crazy. Maybe you need some information on something. Check out one of my Medicare Mondays. You might have that as a brain shark where you can, go through and get the information.
One of the things you're going to hear from my team too, and some of the things I've heard from you is not all of you are in the same area. Some of you work with Turk, some of you work with Renita. Do all of you know who your broker manager on my team is? Anybody want to tell me they don't know? Okay, if you don't, it's okay. Catch me before you leave. I'll make sure you know. So we've reestablished the territories. You should be getting an email from them every Monday. And one of the things I heard from the market, and as a leader, that's one of the things I took to heart, is if you're working with Ryan versus Dan, you should be getting the same message. Now, Ryan may have called more people when Spectrum came in network because that's literally all he did for 2 days. That's different. He's in Grand Rapids. But it shouldn't matter which part of my team you work with. If you're in Sunny team, all of you should get the same message. Sunny will get messages from me, of course, but that you're getting that same message regardless if it affects your market. So that consistency, I heard that from a lot of you, and I apologize for my previous team that's no longer here, you shouldn't have any of that. It should be very consistent. You should all be getting that information. You should get an email every Monday. And then one of the other things is we do brain sharks. I know I talk fast and we are going through a lot, and you're going to all remember everything I said, and it's going to be awesome. Yeah. Okay. No. There's a lot of stuff that'll come up later and you'll be like, they talked about this weird thing and I can't remember it because I haven't talked about it in 2 months. And now I'm like, I've been busy and set up other rollouts, right? So you're not going to remember it all. That's okay. So we do a lot of banked trainings called Brain Sharks, and we'll send those in a blast too. You can watch those on demand. And they're like anywhere from 5 to 20 minutes long on like just dental or just hearing, or just if you need details on that, let us know. Those will be coming out probably end of the month.
Yeah, and a lot of these tools you may already be familiar with, but we're ramping up. You're building out your marketing plans. You need to get familiar and spend some time with some of these tools. Medicare Marketing Studio, making sure you have the arsenal of customized materials in your portfolio before you're hitting AEP. There's a lot of good things, in there. Customize your marketing plan. Work with myself or your broker
We will
manager.
email you it. So those of you who are trying to write as fast as I talk, I implore you that it's not going to work, but you can try. We will email you the deck. Just so you guys have it all. Just know that we're going to send it to you. Just know that we're still changing from NAMBA. A couple things may change, but we'll send you everything we're covering today. I promise.
But yeah, producer world, if you're not familiar, there's a lot of information in there. You can get lost. I always say click individual Medicare first. It's going to get you a lot of the things that are quick links at that time. If it's pre-AEP, OEP, certification, or kit ordering. So, get familiar with that. I bookmark it. I'm in there every day, but it's just practice. A lot of these tools, you work with a lot of different carriers, different platforms, and I get that. So if you have questions, let us know. Benefits checkup, I don't know how much time we have to spend on this one, but it is very important. You wanna
I
take
won't
this one?
won't soapbox because I talked to most of you last night. Okay, so those tools that we're talking about, and you're like, this sounds interesting. And a few of you, we're dealing with Medicaid redetermination across the country. It's not just Michigan. A lot of people haven't reapplied for Medicaid or LIS. What do you do when someone falls off Medicaid? Maybe they still need help, but they don't qualify. There are some tools. So benefits checkup is a tool, and Sunny, we should talk and set up for your crew and just do a training. I think based on the conversation I've had since I got here, it's where you can screen people for other programs. We won't get too into it today because I promised you guys I'll get you out of here. If you're working a lot in the lower to moderate, or even the working poor, too much to get Medicaid or LIS, but not rich enough to be okay, this is probably a tool for you. And we have marketing pieces you can use to support it. So, Sonny, if you want, we can put something on the books for your crew. We do Producer World with it if you want. If not, we have them recorded at aetnamedicareagenttraining.com. We do them at least once a month. Join us anytime. Go ahead.
Yep. HRAs, obviously, Think Agents are our platform. You can do a lot of things in there now. We have put our Medicare supplements, all of our ancillary products in there. You get through your MAPD application, your HRA, you can go into hospital indemnity or cash cancer. So check those out. You can get a lot of materials on there. HRAs, I think, are still subject to change at this point. So we'll, if that does change, obviously you'll get that information. 70 for MAPD, 100, I believe it was DSNP.
Cases.
DocFind. So, I call it DocFind. AetnaMedicare.com is another common link that you'll use a lot for DocFind or for member materials, submitting member DMR forms. A lot of good information in that site as well.
Does everybody know you can submit your member direct reimbursement forms in dental online now? You don't have to fax or mail it in. No, well, you can. It's already live now. It'll save you some time. It's the same form, same information, but it'll save you a lot of headaches. Go ahead, Dan.
Yeah, it's streamlined. It's a lot easier, and we can get that reimbursement out a lot quicker. Obviously, we're kind of split into two kind of segments. We have our senior supplemental side, and we have our Medicare Advantage side, PDP. Both sides have a broker service. You can contact them via email, telephone. Agent services over on the Medicare supplement side, they have revamped their website actually, and they actually have a chat feature where you can go in and actually chat live with somebody. And it's actually really easy, really cool to use.
But they're separate. If you
are
call
separate.
SSI for Advantage Help or vice versa, they can't help you. You'll end up transferred 17 times. You're going to be frustrated. They can't. The only process they share is the background check.
And did somebody have a question? Sorry if I.
Yeah, we'll take them at the end. Go ahead.
I did want to say member services kind of versus broker services, and I get this one a lot. We do have two separate things, you know, the number on the back of an ID card, member services. If your member has an issue or you need to three-way dial member services, make sure you don't go to broker services. You could start spinning your wheels. So if it's broker related, keep it with broker services. If it's member related, get the member on the phone and make a three-way call or go through member services. So
And one of the tools that we have for you guys, we created for this market last year is a magnet. Have you guys seen it? I know you guys have who came to Ryan's thing. We
these
had them
were
out.
free too, these
They're free magnets. I gotta be a visual. I broke my mic. We want them to call you. So there are these oversized fridge magnets, but they're sticky on the front so that you can stick your business card to it. You can't lose it. Okay. I mean, you could, but it'd be hard. You'd take effort. It's got a who to call, where to call, what they do. Because one of the biggest things we get is people, I called Aetna. No, they went online and found some random Aetna phone number. It was completely the wrong place. They got transferred 17 times just because they ended up at the wrong place. If it's dental and it's Medicare Advantage, it's not Aetna Dental. It's a different department because it's with the Medicare plan. How frustrating is that for your member? And if you go to Google and look up Aetna Dental, you're calling our dental department. It doesn't work with the Medicare plans at all, right? It's the wrong place. So it's just a really easy way for your members to have a snapshot. When in doubt, they can call you. You're their person, but you're right there present. A lot of you have your picture on your card, so that's a bonus, right? But they're oversized magnets. They're free. It's got most of the common phone numbers. You pay for shipping. You go into the marketing studio, you order them. You literally only pay for shipping. We pay for them otherwise because it'll help you with retention. And it'll help your service and your member satisfaction.
tracking apps. I mean, I want to keep this kind of quick. So
All right, you can
there's
track your.
multiple ways.
I got it. You can track your couple ways. Go to your report in Producer World. You can go into Think Agent for anything you did on Think Agent. Everything loads to Producer World. You can call broker services or email them if you have a question on an app status. You can always see it. This is information I'm not going to read you. Talks about if you have a pendant app and an application error, the two ways to fix it. One is pre-sale, one is post-effective date. It tells you what you can and can't do, and it tells you what form to use. I will email it to everybody. There you go.
That was easy.
I created the deck. So I was like, I'll wrap it up with a bow and get you guys out of here. Go ahead. Near you.
This was you.
Want me to do it?
Yep.
Okie dokie. I told you, again, I think I'm funny. Okay, so if nothing, I'm entertaining. Okay, so on our MAPD plans and MA plans, we have extras on all of our plans. So rather than do a slide per plan and make your brain bleed, it's the end of the day. I put it all in one slide for you. Easy peasy. If you have a Medicare Advantage or a Medicare Advantage with drug plan with us, you have these things, right? So how easy is that? Resources for living. Anybody remember what that is? This is like an Angie's List. Okay, this is an interactive class, so I'm that teacher. Okay, so it is. It's like an Angie's List or concierge service for your members. Non-medical services helps them find services when they need them. Contractors, maybe they need help, in-home support, not Medicare covered things. Silver sneakers. You also have like the Get Set Up and the Apple Fitness and the tuition rewards. Does everyone know about Silver Sneakers tuition rewards? Anybody not know what it is? It's okay. I won't hold it against you. It's okay. All right. So the Reader's Digest version is you go on to silversneakers.com. The member does, not you, or you with your member. Okay. Go online, sign up. You need some basic information, member information, and then a loved one aged K through 11th grade. You can't have, like toddlers. You can't have anyone who's not in high school. And you get their information. You do need some information about said child. You go in there, you sign up. Just for signing up, you get points. Okay. And then if you go to the gym right now, it's 7 times a month and scan in with Silver Sneakers. They could change it. They own it, not us. You get points up to 250. 250 points a month equal dollars for those, 4 out of 3 Americans that are bad at math. That adds up pretty fast. So what happens is you get points. So you could have, so Dan has 6 kids, true story. So let's say you have points for, you're laughing one there. He's got a college one, but let's say they were all not in college too now, right? So let's say, so you got the 4 younger girls. They're all girls too. So the 4 younger girls, and he's got points. And the oldest one, when she gets done, she says, you know what, Dad, I'm going to go to tech school for something specific. Those points aren't any good for her. They can rotate and move them around as long as the kid is eligible. How cool is that, right? So it's about 400-ish. Don't quote me on the number. I don't own that. 400-ish is my technical term. Universities throughout the country Those credits go towards that college. Now, I don't know about you, but think of any grandparent, my parents included, who would happily push me in front of a moving bus to protect my children, but I'm okay with it. So there's 5 grandchildren in my family. The oldest one is going to automotive school. We already know it. His points are no good. My daughter is going to do sci-fi makeup. She's completely not interested. But my 12-year-old, he's a brainiac. He will be in school his entire life. He enjoys it, right? You can move those points around per child. So really, what is a better way to encourage any parent or grandparent to do something healthy for themselves than say, you know what, it's going to benefit the child that you love most, right? So that's the tuition program in a nutshell. Fun facts for everyone playing the home game. There's a flyer on silversneakers.com that's CMS approved that talks about it that you can use. Okay. All right. Fitness DMR, national parks, yoga mats, tennis shoes, direct member reimbursement. They go get it, they get reimbursed. Super easy. Can put it's our same DMR process we have now. So those of you going, I hate new benefits, they scare me. It's not new. It's a new type of DMR, but our process is the exact same as it is now. And we streamline it digitally. So you can fax, you can mail, don't mail, you can mail, don't mail. You can fax or you can put it online. But they can admission to national parks, tennis shoes, yoga mats, fishing poles, things like that. Active lifestyle. We'll tell you the amounts in a minute. Ask a Nurse. We have Ask a Nurse on every plan. We've had it for years. Over the counter is now good at any freestanding CVS. You can just go in store. You can still order online if you want to. You can still do all of that or call it in. But most people like to pick up their items. They can go to any freestanding CVS, not the ones in other stores like Target because we lease there. We have telehealth and minute clinics with all of our plans. You get meals post-hospital discharge. Again, no changes. Healthy home visits or Signify. If you have a member who calls you and says Signify calls and wants to do a healthy home visit, please encourage them to do it. Well, they have a doctor. I know that. But when's the last time you saw your doctor for more than 5 minutes? It's okay. I know the answer. It was rhetorical. So most people haven't, right? How many of your members do you think have more than one doctor? Who thinks those doctors talk the way they're supposed to? So what are you relying on? The member with a condition to tell you all the information about what's going on with them. Guess what gets missed? Medication mismanagement, things of that nature, right? So they go into the home free of charge and ask questions. It's not a pyramid. There's no blood. There's no urine. It's not invasive. But they'll see if there's a fall and fracture risk. Is there something in the home? They'll make recommendations to the PCP for that person, and they'll tell the health plan. And people are always like, what happens to my plan? We don't kick you off. We don't raise your premium. We may put you on disease management. We may help you get other benefits. We may recommend in-home services because you guys all have clients. They go to the doctor, they're going out, they're getting dressed to the nine, their makeup's done, they're looking nice. You go inside their house, you can't walk. It's filthy, they're food insecure. But you wouldn't know that if you saw them at a doctor's office, would you? So they can help identify some of those, health things. One Touch is our diabetic supply vendor. That is for, when you have a freestanding glucose monitor, not a CGM. I feel like we covered that earlier. CGMs are different. She's back there. We have an entire flyer though in the marketing studio. She's waving. Right here, I got it. One Touches are exclusive for anything not for like the freestanding, and you have to use One Touch or you have to pay a charge for it. One Touch is free. $0 copay if you're compliant. Okay, so but we have a flyer that talks about what's D, what's B, and what needs approval, what doesn't, and what's the cost. If you need help finding it, it's on Producer World or on the marketing studio. And then health risk assessments, $70. More to come because we've heard some positive changes are coming with the timeline on that, but I can't tell you because it's not official yet. How am I doing on time? Good?
Good.
We have one expansion county because we're already all these places. See the purple? Rock the purple. We are all the purple places. See the dark purple? We added that. That's what I got for expansion because we're already almost everywhere. Go ahead.
Yeah, so a lot of what we're doing this year, we added some new products with design in mind. We're really going to focus on fitting our consumers, your clients to the right plan. There's not a one size fits all. And doing that is going to, more retention, ease of mind, better utilization of benefits. They're getting more out of their benefits because they're on the right plan. Now, there is no, this is the best plan in the market. They are designed. We have a plan for each type of consumer. So we're really going to, kind of go through that process in our trainings, in person, virtual. So, follow up for more.
But But we have a retention program. So some of you actually have been part of that already. We actually have broker-led retention. We have a retention specialist that just for our market. So every company wants to retain. I don't care which carrier. We want to keep our members, right, guys? I mean, it doesn't matter who you work for. We would like to keep our membership. That's our goal. So we do everything we can. We have retention programs and tools for you as brokers. In most cases, we only sell through brokers, so that's a big part of it. And then we have tools, and then we have a retention specialist on our team that works on our market's retention. We have the national retention team, but we have someone in our market. She actually lives in Michigan, and who all she does is focus on retention and activities in this market. So in October, your members are gonna be like, I got invited to an Aetna meeting. And you're like, what? They did. We'll send you a notice. It's called an ANOC, annual notice of change. Why? It's not a sales meeting. Your member can come in. We're going to just review the changes on the plans that they're already on. We're not going to make a recommendation. Our team can't sell, so there's no Aetna person selling against you. We're not allowed to. Everyone on my team has sold. We were agents first. We get it, but we protect the agent. These meetings are designed to help your member get more from their plan. And where else can you go that our customer service will come in person and the member can sit down and talk to them? So if you're a member, you have concerns, questions, whatever, our sales, our internal sales team and our leadership team will be there. So we're there because, well, we design the plan. So we can answer questions if they need them, like in-depth stuff that you guys may not hear or see, or they may not talk to you about. And that's okay. But customer service will be there. So will most of our vendor partners. Silver Sneakers, our hearing vendor, iMed, things like that. So those will be happening in October. Go ahead.
Yeah, I mean,
Yes, sir. They get a mailer. It's actually a direct mail. We don't do them in all areas. We go to like the center populations of where we have membership. So if you're in a very rural area, not all your members. So if you have a member in a very rural county that's 30 miles away from the closest meeting, we won't invite them, not because we don't love them, because all we will do is tick them off. Because it's hard to get there. You can have access issues, transportation issues, and we don't want to create another issue. So we pull a radius based on the location, but our locations are picked based on where the membership is based.
yeah, I mean, this is kind of the breakdown and kind of taking it back to the basics. And, everybody has their own process of their sales process, from beginning to end. And it's pretty much very similar each time you do it. I mean, a lot of different outcomes, a lot of different conversations, but you're really uncovering a lot of facts. You really need to understand a little bit more about why they make some of the decisions, what things they're doing, what motivates them, what are their activity levels. And we'll get more into that a little bit later. But finding their access to care, provider access, prescription, obviously we're using DocFind. We're going through prescriptions, but we need to do a little bit more than that. Are they higher risk for more RX utilization? Are they maybe taking a maintenance drug or one generic? There are different plans that can benefit just on that alone. So there's a lot of ins and outs that we're going to get into with our plans. And breaking it down this way, getting them on the right plan it's easy. Include some extras. We'll get into portfolio selling. You're not selling specific benefits, you're selling an entire package, right? You want to keep your membership. The more you can do to protect them, the more they're utilizing their benefits, the more retention and the more growth you'll have.
Well, I think one of the key things that I get the privilege of working with people across multiple states, and I absolutely love it. I see some good, I see some bad, as you can imagine. I see some really, really good, and some I'm like, that makes me uncomfortable. So it happens. We all know there's not all agents are doing the right thing, which is sad, but it's a thing. Ask people what they like, find out, and matching it to their needs. In some of the metro areas, we've had some challenges where this is your favorite plan. That doesn't mean it's the right fit. Like, dig a little deeper. You can put everything in Medicare.gov, but it's not lifting the hood. It's not giving you the extras at a snapshot. It's going to tell you based on medical and prescription. That's great. But is that where the cost is coming for your members? Maybe yes. And if it is, you might be okay. But lift the hood and dig a little deeper. Our retention rate's right around 97%. It's what we strive for, is to stay over 95 at all points. But that's a big part of it, is like lift the hood and dig a little deeper. And those tools are great to start. I'm not faulting anyone's tools, Medicare.gov, any of your uplines, not at all. But they don't lift the hood on some of the behind the scenes stuff that really is important to your members. So don't be afraid to ask the questions.
Yep. And we do have programs that actually incentivize your retention. So that's how important it is. We're incentivizing you to keep growing your book and retain it as you grow.
Some of you, I know, show of hands, who got retention money for AEP and OEP last year just based on keeping their retention? You kept your members, and we gave you money to support you continue doing that, right? It's not commission. You're not getting a check. It's to help you do the right things, keep your members, and stay in contact with your members. We take, again, being broker driven, we're extremely serious about it. So, questions on anything we've covered before, and then we're going to dig into this year's plans. Yes, ma'am. Okay, so her question for everyone in the back who may not have heard anywhere is, when we take a new hospital group on, do the PCPs associated with that hospital come with? The answer is yes. So when you have a hospital group that signs a hospital-based contract with a physician group, and there's the tax ID number that's associated with it, which means they're owned by the hospital, they are employees. Okay, they're going to be part of that contract. HMO and PPO contracts are done together. So we don't say, do you want to work with us on our PPO? Don't talk about the HMO. No, we want to talk to you about both. It comes together unless there's, again, what, Prime or some of those medical partner, and you'll see that stuff in the name. So, but most of our plans are national. And we do it to keep it simple for our members. Remember WYSIWYG? What you see is what you get. Keep it as simple as we can for our members. That is our goal. Caveat is, if you have a provider that is associated and has privileges multiple places, and maybe they work at 4 different hospital groups, we do need to check them online and be kind of careful, because they could be billing themselves as themselves. We don't control that. Neither does the hospital group with the contract. So sometimes a private practice doctor, you do got to check, because they can bill under different tax IDs based on where they're at. That's a legal thing. But when you look in the provider finder, it'll show you the location. So if it says they're on Smith Street, they're fine on Smith Street. Maybe they go to like across the border into Ohio once a week for this other provider and it's not showing. Don't tell your client not to go there, because that location, for whatever reason, they didn't set up with. And it could be any number of reasons, which is a whole different can of worms. But if you check online, it'll show locations, the provider. And if you see something wonky, you let our team know. We can always have our provider team investigate it. Is that good?
Michigan froze their system, then they were showing still helping Michigan, even though they were over the 85.
Yep. So with the DSNP contract, we have a certification with the state we have to agree to. If the state's records are on hold, and Michigan was an issue last year, this is not the first time that's happened. They got behind. So if they're behind, when they're behind, we can't move that needle. So unless we have something documented from them, it has to come from Medicaid, giving us the dates and information, we can't. Our contract forbids that. So we're not going to accept something unless we can authorize it, because the state, not anyone else, you can't give it to us. The state has to verify that information. I don't, her question is about Medicaid. I don't have a crystal ball to tell you if I think that that's going to work or not. I can't. I can tell you that it's what we're seeing with Medicaid is cleaner records. I'm not going to tell you it's perfect. It comes from the state, so there's a lot of moving parts. Is it better than it was? Yes. Do I anticipate there'll still be some road bumps because of the sheer volume of people? Hold on. Hold on, please. And then I'll take your other question. So we, and other carriers do it different. If we don't get verification from the state, we will not put it through. You can get documentation, and we can talk about what that looks like later if you'd like. I'd happy to show you. If they, not anyone else, provides documentation, we can put an appeal in for it, but it has to come from the state. If the state doesn't verify it because it's our contract, we will not. And that keeps us in the good graces legally. So everyone does it different, but that is our contract, and we take it to the line. But it is better. The state has cleaned up their records management quite a bit. So the last few months, it has been better. I'm not saying it's fixed, because of the determination. There's a little bit of lapse, but compared to where it was a year ago, it's much better. So I see it improving. I don't know that it'll ever be fixed, but I see it improving for the state of Michigan. Michigan's not the worst state. Illinois is way, way worse, but Michigan has improved significantly. You'd have to buy me a bottle of wine to talk about Illinois and cover it, because it's pretty bad. You're laughing. I was serious.
Okay, we're gonna go over plans here. The first couple we'll go through are our existing plans and some of the upgrades that they took on. I know we don't have any printed material. This may
I'm
be
going
a
to give
little.
you one more thing for you. I'm sorry.
Go ahead.
He's going to kill me. Other thing, the state of Michigan and Illinois and a couple other states have MMP, which is state-ran Medicaid. So I'm going to give you a caveat, because the amount of issues I've fixed having to do with what the state has done, it's a lot. So if the state puts someone on an MMP plan, you need to contact the state or Medicare to stop it. We can't kick them out. It's a state program. I wish we could. That's a whole, again, bottom line. So if you have someone who gets a letter, please encourage them to open their mail because they get a letter from the state of Michigan. And it says, if you don't do anything by this date, you will move to an MMP plan. They're serious. If you call Aetna, we can't stop it. It's a state program. It's a contract they have with the government. We can't stop it. Now, we can fix it after the fact, but usually you're going to have a month of coverage changes. So that sounds fun, right? No. So if you have someone on an MMP plan, it's the state Medicaid plan for everyone playing the home game, not a DSNP that you sell. This is the ones ran through the state, and there's multiple carriers that have it, including Aetna. If that happens, they get a letter. There is a number on the letter. It tells them to call that number to stop it if they don't want it before the effective date. Make sure they call that number, and then the state will stop it. If they don't, the only place that can stop it is CMS. And if you do it after the fact, it will happen the next month. So I'm only telling you this not to be worried about it, more to be in front of it. Medicaid redetermination is a thing. The state is not the most time effective place. You know, it's not just Michigan, but keep that in mind. If you have someone who's dual or on that cusp of being dual, please open your mail. If you have questions, just call me. Read your mail. It's an easy thing to fix if you do it on the front end. It's not an easy thing to fix if you do it on the back end because we can't fix it. No carrier can. Because even though we're one of the companies that offer it, it is a state contract and it's administered through them. Okay? Does that make sense? Yes, no, maybe? Okay, go ahead.
Question. I'll get there. Yep. Oh, well, there'll be plenty of materials. Absolutely. Again, this hasn't even been printed yet. So, yep. They're going to be good answers, right? Yep. So yeah, this is the premier HMO POS. This has been in the market. It's a $0 HMO. This is a national network. It did get an enhanced benefit with the dental up to 2,800, and this is simple dental, guys. It covers all dental codes, ADA dental codes. You don't have to be confused with that in a dental. Well, is it covering full cleaning, partial cleaning, implants, dentures, veneers,
Yes, all the things.
all of
Yes.
the things, minus cosmetic like teeth white. So all ADA dental codes on all of our plans.
So if you look in our
That's simple.
EOCs, for those of you who have a little light reading at night on your board and maybe can't sleep, read the EOC, you'll be sleepy. So when you get into there and you're looking for dental, it's this really short section. And I get so many questions like, where's the dental? No, that's all I saw. That's all that it is. It is that simple. It has to be an ADA dentist. Don't go to a dental school. I don't know how they bill. I can't control that. Don't leave the country. You cannot go somewhere in another country. It's cheaper. I can't control that. Medicare says I can't pay those people. Medicare is a state, federal program in the United States. So you have to stay in the country. You have to go to an ADA dentist. You can't get your teeth whitened, and we won't pay your missed appointment or administrative codes. If you don't show up for your appointment or pay your bill on time, we are not paying your fees. That's all I got. We cover implants, dentures, implant repairs, crowns, getting crowns and fixing your crowns, entire teeth cleanings at the same time. No breakdown, no single tooth exclusion, none of that. No waiting periods, no class benefits. Here you go. That's your dental. It's simple. I know you want me to make it more complicated because it's so simple, but that's all it is. You can go in network or you go out of network. You've covered either way. If you go in network, they'll bill us. You'll get more for your money. Pretty simple. So I always get like, what about this? No teeth whitening, no administrative codes. Go to an ADA dentist, and you'll be good.
In or out of network.
Yes.
Did you want to explain the 80/20
We will do that in a minute.
on the next slide?
We'll do that on all of the plans in a little bit.
Okay. All right. So yeah, you're going to see this new one. This is the new fitness DMR. This plan took on $600 a year in fitness DMR. We went over a lot of what that looks like. It could be.
What can you use it for?
Yeah.
Fishing poles. They got that. What else? Dan's hanging out with whoever said that.
Yep.
What else? What can you use it for? It's fitness DMR. I have all day. National parks, fitness
Exercise
equipment,
equipment. Yes.
tennis shoes.
Tennis shoes.
Cool, right? We're pretty excited about it. Hopefully you guys are too. This is a really flexible benefit for whatever lifestyle your client leads. And it's on all of our non-decent plans.
How do they get reimbursed for their fitness items that they paid for?
You get an itemized paid receipt. You send it in showing it's been paid, and we send you a
The
check.
same way you would do a dental DMR.
Do you have to mail it in?
Nope.
How do you send it in? You can do it electronic, or you can fax it. You can mail it. Don't mail it. You can mail it, but I wouldn't, because I mean, by the time we get you're adding 2 weeks to your processing time because it has to get in and get processed. If you send it in digitally, you're going to cut 2 to 3 weeks off your processing time. So it's much better for your member. Okay, go ahead.
Yep. Stuck at $3,900 MOOP. I don't really talk much about MOOP. It's usually irrelative, but yep, including no copay stackings, which is a lot of savings in the plan year as well. $90 OTC. I think that is the same. It may have gone up a little bit. All around on all of our plans, we added a $400 wig allowance. This is new. Post chemo, wig allowance it's a Medicare addition this year. We did add a $100 medical wrap card on this plan. So when I say, it's a flex card, right? You're gonna get a separate card, but it is a medical wrap. So you can use that extra, what is it on this, 100 for medical services. Maybe a specialist visit, and you want to take that off of your medical wrap card, or off of an inpatient hospitalization, you want to put that $100 towards that visit. Anything medical. So dental, vision, all those, not medical. So just medical. Prescriptions, not medical. So again,
Anything that wouldn't be considered a Class C or Part C benefit, the medical side of the medical program is not included. It's an easy way to remember it. But let's say you have someone who wants to go see one doctor out of network to get a second opinion, or maybe they want to see podiatry more than the allowable amount or something of that nature. They can use it for it. It's per quarter. It doesn't roll over, but it'll help with some of those copays. The idea behind this is hoping that people will go get their care, because sometimes paying a copay can be a hindrance, especially with chronic conditions when you're going more often. So to help kind of levelize some of those costs and hopefully take it off the member.
any questions on the new benefit with any of these new benefits yet? We're good? Okay. 230 IMED, I think you're all familiar with IMED, the IMED network. It's not just your JCPenney or your Target Optical, Sears Optical, Lens Crafters. It's huge. You can access that online, find the provider network.
Don't use our normal provider network. You go to Aetna MedicareVision.com. It is different than our standard provider. If you go to our regular provider tool, you're looking up a specialty provider, which means you're going to pay specialty copay because they're credentialed as a specialist. Now, they overlap all the time, but not always. If you go to Aetna Medicare Vision, AetnaMedicareVision.com, that's where you're going to go. You'll find the providers that are set up for this benefit. If you go to an IMED provider, you're not going to find IMED on a building. You'll find their little icon anywhere that's IMED. You will see it once you're there, but they contract with lots of providers, more independent providers than national, which you may not know. So they work with a lot of even small shops in the local areas, which is great in more rural counties. Your member will get a discount and be able to use the allowance on site. If they go to a non-IMED, they can still get their contacts or glasses. They can pay and get reimbursed. We all know that a lot of our members can't afford to get that and wait. I mean, it's 4 to 6 weeks. It's pretty efficient if we get what we need, but they can't wait for that money. So they just won't go get glasses. If they go to an IMED provider, they'll get the discount and they'll use their allowance on site. So it helps kind of get some of those barriers away from them getting care.
Yep, silver sneakers, that's on all of our plans. And, some people have actually purchased plans because they had silver sneakers. So keep your eye out. Look at this, learn more about your member. Talk about this fitness DMR. Talk about a number of things depending on the product. So, whatever their activity looks like, keep an eye out. We did lower copays on all of the rehab therapies, speech, occupational, physical,
Cardiac, pulmonary.
pulmonary. Yep.
And instead of taking an entire page, we just put it as all rehab. Most of them went down $5. Some of them went down more. I didn't want to make this a super long deck. So when you get to summary benefits and you look, all rehab went down. So regardless of the category.
We're given overall features, a lot of things within the plan that you don't see in a benefit summary, et cetera, having come down or increase in benefit allowance. Sure.
Let's say I had a surge that wasn't in that. Is there anything that you can do to try and encourage them to accept that?
Yes. We can, let's talk that offline, but okay.
Okay, moving on. Many of you are familiar with our value PPO. It's our $0 PPO, the 5521214. Again, $90 OTC. But on this plan and many of our other plans, we are now going to be sending an initial care package on the OTC benefit. So right off the bat, your members are going to receive a care package, a medium-sized care package with a lot of the common ordered goods.
It's within the first 90 days of them being active. So not based on enrollment. So let's say you enroll them in AEP for January 1st. They're going to get that within the first 90 days. So what is that good for? Because it came from Aetna, but you know that it came from you, Ken, right? Because that's what it's going to feel like to remember, right? Is it came from, it's that warm and fuzzy, that first beginning of the year, people get confused, new plan. This is a really nice thing we do. So everybody on the plan will get it within the first 90 days. So they start usually the second week of January is when we start sending those out. It doesn't go against their OTC allowance, though. They're not paying for it in addition. They still get their allowance and their dollars to spend. This is something we do in addition.
It's actually one of those benefits that goes overlooked, and then they may see it on TV and forgot they had that benefit, and you may lose a client if you're not following up with a OTC benefit allowance in the first quarter. So it's going to help member abrasion, help retention as well.
And we're sorry, but not really, that it's going to make them call you and say thank you. That's kind of the point. Make them, help. It helps your retention, which is always the goal. Give them a good experience right to start. Give them the information, and they think it comes from you. We've done it multiple years in a couple of my markets, and they're always like, "Our phone has rang so much. Stop sending them." If you have a big book of, I'm sorry, but I'm only a little sorry because it's really good for your retention, but it might make your phone ring just a little bit for a couple days.
Sure. Yeah, okay.
The amount, okay, and then we'll get into a little bit like administratively how it works for a little bit. Is that okay? Okay. Good.
Okay, move on. MOOP is $49.50. 200 IMED, 0 labs. It's always good to see 0 labs, 0 flat copays in general, no sliding scale co-insurances.
So you guys know we send those surveys and ask you what you want, and I ask you lots of questions. Those of you who've sat and talked to me, I ask you all kinds of questions. Like this lady asked me so much crazy stuff. We really do listen. $0 labs or an abrasion for members getting their labs. Okay, cool. It's now 0. So we really do take that to heart when you guys tell us there's something that's abrasion to our members.
Again, the $400 WIG allowance, that's across the board on our plans here. $750 Nations Hearing. You should be familiar with Nations Hearing. That's our hearing aid benefit. That's per year, and that's on all of our plans per year. Lower urgent care copays came down too. So another, access to care item, added benefit there. This plan did take on another medical wrap card as well.
$200.
$200 on the medical flex card. So it's a pay flex card, right? But it's actually for medical only, all right, on these plans.
And some of you may not be familiar with PayFlex. That's actually who we use on our commercial side. We've used them for years. They've been our partner. I've been here almost 17 years. They've always been our partner. So we, have a long-standing kind of administration side with them. So it's pretty seamless. And we've actually had this in other markets. But again, this is medical. This is not a flex card. This is medical copays, medical services, things on the medical side. So not drugs and not OTC and not like dental, vision, stuff like that. It's going to be true medical. So when you have someone on a 0 premium plan, they generally have higher copays, especially on a PPO. We all know that, right? You get the freedom. There's some copays that could be higher. We lowered a lot, but it's still, they can be sometimes, it can be a hindrance. So they can use it. It's quarterly. So it's 200 medical wrap. Quarterly does not roll over. So encourage them to use it.
Silver sneakers, again, lowered copays on all the therapy, rehab therapy, and we lowered the outpatient surgery from $350 to $250. And that's incredible. I mean, this is a flat copay for an outpatient surgery. No copay stacking, whatever's going on, it's a flat copay. So that decrease is a big advantage for us there.
And when you look in our summary benefits, it always shows like outpatient surgeries and services together. It's Medicare verbiage. I hate it. They won't let me change it. I've been trying for 4 years. But when you look in the EOC, it'll show you outpatient services versus outpatient surgeries and observations. Our observations are also a flat copay. You're not going to see those weird percentages. Who the heck knows what 20% of the Medicare approved amount is? It's never like a flat number. You know, Medicare will be like $892.60. Where does that number even come from? Like that's like even if you're good at math, that's hard to do, right? So it's flat copays. You're not going to see those unknowns, and the EOC breaks it down more. An example, but I would like to point that out because some outpatient services, not surgery, are like $35, $40. It looks like it's not a range; it's that or this, but that includes observation. But when you see our EOCs when they come out on October 1st, you'll be able to see the like all the details for those of you who need some in-depth reading. But it did go down $100. And then the other side, outpatient services went down too. It's kind of a weird read when you look at it.
You good?
I'm good.
Did this switch? There you go. Okay, moving on. So we have our Premier Plus PPO. That's our $20 premium plan, the H5521217. Let's see here. So this was a $75 OTC. We're not going to break all these down again. We just went over them a couple of times. So it is getting the initial care package, $1,750 for the DMR dental. Did you want to explain that now, or did you still want to wait? Okay. $225 IMED, the hearing aid benefit with Nation's Hearing is $1,000.
It's per ear per year. I know one of our cohorts said the same thing on their plans. It's per ear per year. That just looks stupid on a slide, and it's like a whole big no. Per year. That's the allowance for each side. And there's a detailed page on the Nation's Hearing and how it works in a few minutes.
Yep. Silver sneakers, rehab therapy copays going down, lower urgent care copays. So this came down as well. $400 wig allowance, 0 labs again on another plan here.
So what you're going to see as he flips slides is we really tried hard to look at the things that are hindrances to people getting care. Like is there a utilization or benefit that the copay is essentially stopping someone from getting the care they need, and that's where you'll see most of the changes we made are on those benefits.
Okay. Do you want to run us through DSNP?
Yep, go for it.
Okay. All right. So many of you are familiar with our DSNP already. I don't think it took any extra counties this year. So we're staying put there. Our dental benefit did go up another $500. So that's $3,500 dental. This is network dental, which is still Aetna's national PPO network, but it's all dental codes again, as long as it's a in-network dental providers, right? So $220 per month on this flex card. So this flex card is a little bit different, not like the medical wrap cards on the traditional plans we had. On the DSNP, it's taking on a lot more utilization. So that's $220 per month on a lot of the items you see there. However, you can get an extra $30 a month if that member is seeing a high value provider. You may be familiar with maybe a value-based contract provider, similar like Oak Street. That's been a partner with us. It's a recent acquisition with us. So if your client sees one of those high value-based providers, it's an extra $30. Now, if you're looking in DocFind, finding their PCP, it will say right there if they're a high value provider.
So one of the things, and I don't want to move on, and then actually there's a mistake on the slide I'm going to tell you, but it's not a bad mistake. It's actually a positive mistake. So I'll just tell you in a minute. You have to put the PCP on file when you do the enrollment. For that to count, it has to be on file as their PCP. We cannot guesswork or because they have a claim come in. That would be awesome, but it doesn't work that way. They have to have a PCP. You can do it on a paper app. Don't do paper apps, but you can. Think Agent, whether you use your upline tool, you can put the PCP when you do the enrollment. If so, and it will indicate on the DocFind if it is a high value provider. It's an extra $30. And this is not a medical wrap card. This actually cannot be used for medical services. It's the exact opposite of everything else we said. They're going to be able to rent utilities, gas, things of that name, really parts of like living. I just got to fix the bullets. They do have access to care. It's not part of the card. Access to care, 50 one-way trips up to 100 miles for access to care transportation. There's a whole page on how it works, but that's not different than the vendor we use now. They get some pet care, and they have the emergency system through LifeStation. Those are not part of the flex card. It's just our bullets didn't line up right, but I'll fix it before I send it.
It's included in the flex card.
That's because our slide was full.
Angie, that's correct. It's included in the flex card benefit. So it's kind of all in one card.
like some flex card benefits. So when you look in the EOC, it talks about OTC. It does have OTC. Again, this is just the highlights. A lot of the changes in the bigger amounts is kind of what we focused on. Not everything, but no, they do still have OTC with the plan. On all of our plans have OTC included. This one, they actually have that OTC that with the flex card piece too. Good, Dan.
Good. Okay, $500. IMED, 2,000 Nations Hearing. That stayed the same. That's per year. 60 hours with helper bees, which is new this year. So this is more of an in-home, low maintenance assistance kind of
In-home non-medical care.
non-medical
Yep.
care. A little
Because if
bit.
they need medical care that's covered by Medicare, there's a process for that. This is outside of that. And that's our new vendor is Helper Bees. All they do is home care. So they'll get 60 hours of that.
Yep. And the $400 wig as well. Any questions on the DSNP before we move on? Has anybody sold one of our DSNP plans?
Thank you.
Anybody excited to sell more of our DSNP plans? Hands? Took a lot of benefit. This is a great product to have in your portfolio.
It's just copied from another deck.
Okay, so our MA only plan. Do we have any veterans in the room?
Thank you for
Thank you for your service, guys. This is a thank you.
Woo!
Applause. Oh, that was weak. Can we give them a round of applause?
Come on, guys.
In all honesty, this is a great product to have in your mix. You know, whether you're partnering in the community, it's something near and dear to your heart, part of your family. This is a great plan. And it's a great way to grow your business. It's another tool in your arsenal. So this is MA only. Obviously, there's no prescription drugs on this plan.
And it's a PPO, so you can't add a drug plan. It's a PPO, so you cannot add a drug plan.
It's giving you flexibility, a lot of flexibility here. So I can't see those over there, so bear with me. I've got a 0 premium. It's the same, 0 PCP, 0 labs. Standard, it was the same last year. OTC is included. I don't know what that went up to. Was
120.
it 120? 120 OTC plus that initial care package. The dental actually went up too. I mean, $3,500 in dental. This is a total passive network. This is 100% your allowance, any ADA dentist, anywhere, any dental code. So that's a huge add. 500 IMED, the hearing aid, I think, is at 2,000, 400 wigs, and we lowered rehab on that as well.
The thing with the hearing aid, I always like to caveat though, is they have to use Nations Hearing, which is our exclusive vendor. We do not cover hearing services through anyone else. So if they're doing something through a VA or a VA-based provider, it will not coordinate. So it's really important that they need to figure out where they're going to get the best bang for their buck because they can't coincide.
Any questions on the MA only?
It's got a $70 Part B give back. So
yes, that went up what?
Who sells our MA only plan? Okay. So with the MA only, one of the things to note too is let's say you have someone who goes to the VA and gets services is who you usually sell it to. Now you can sell it to other people. It's not a veterans plan, but we know that's a lot of who buys it. Let's say they go to a VA-based provider and they pay more than they would with the copay with us. Do you know that they can get reimbursed the difference? I did not say the whole amount. If they use a VA-based provider and they pay more than they would have paid with us, do you know they can get reimbursed on the difference? Oh, see, nobody knew that. See, that's the one thing you can take from what I taught you today. There's a form, the VA provider has to fill it out. There's no workaround. It has to come directly from them. And so it's going to be, and it doesn't come up very much. Our out of network services, a lot of times they're flat copays, but if they're paying more at the VA than they would have for the out of network service with us, specialty is the one that kind of comes up in the most sometimes. They can get reimbursed on the difference, not the full amount, the difference. But for someone who uses a lot of services or is maybe a high utilization provider, can save them some money. Nope. Think of them like parallel lines, like the VA does their thing over here and we do our thing over here. There you go. There's a whole like deck I could show you, like it's like 25 pages long about it, but it truly is. I mean, it does its thing over here and then they do their thing over here. Now there are some unique circumstances under emergency situations and providers when the VA can't offer services in the area, things like that, but that's kind of getting in the weeds. where those things do not apply that way. But no, they do their thing, we do ours. That's why we offer that process, is to really make sure members are not having a hindrance to access to care. They're going to get the best price and get the care they need when they need it. It's kind of one of the things that we take really seriously. If they really like a VA doctor, but it costs a little bit more, that shouldn't hinder them from going to that person. They cannot use our flex card with DA services. That does not work, because again, government to government, they can't cross.
And we kind of
That's more of a legal thing.
Do you want to touch on any more? I mean, we basically already went over with
This is a really boring slide that says everything we just said about who makes sense for a MA only plan. A lot of you sell them to veterans. We know that. But if you have someone who has maybe an employer group situation where they have really good, really crappy medical benefits, but a good drug plan, or they're on a high risk drug or something, you can't have two Part D plans or comparable. Legally, you cannot. Sometimes that makes sense, but we see more veterans than not, or people who thought they were joking in 2006 when Medicare modernization went into effect. They said you had to take Part D and they didn't, and they have this huge penalty. Sometimes they'll do an MA only because they can't afford the penalty. There you go. Okay, so you want to hear about our new plans? Well, you still awake? How we doing? Okay.
All right, featuring the first one here, we have a Value Plus plan this year. This is at a $31 premium. You can see the plan number there. There's a lot of intricacies with this plan. You want to take this one? I can't quite see over there anyways.
I'm buying you glasses next week. Okay, so this is a plan that it's not LIS based. You don't have to have LIS to have the plan, but it really is targeting, like, if you're like, who does this fit? This is really designed with that LIS member kind of in mind. Why? Medicaid determination is everyone's favorite party game right now. We're all living it no matter what state you're in. It is causing some heartburn across the country. So a lot of people are not going to have Medicaid anymore, but they still need help. So this plan really is designed with those customers in mind. It does have a $31 premium, but if you're a full LIS, guess what? It has a $0 premium. So we usually don't wait 100% to Part D. Those of you who've worked with us a while, it's not really how we do things. We did on this plan. The other thing we did is there's a high tier deductible on Part D. Guess what? If you're on LIS, you'll never pay it. But you know what we did is we built it in. Why? Because then we had more money to do other things for the member. Because if they're truly on LIS and this fits them, they're never going to pay a deductible because LIS is kicking in, right? Everyone knows that that's true. That is a true statement. It was kind of a question, but it's a true statement. No, it's only in certain counties. But when you get our benefit books, it gives you all of the information, or you can look at our first looks online at medicare.com and it'll show you which counties go where. We're just kind of digging into the southeast part of Michigan because I promised not to keep you here for 2 hours, and Sunny said I can only have an hour and a half. So we have stuff in other markets, and I'll talk about how you get that information in a minute. Really cool plan. It's got some transportation built in. The other thing is it's got, a medical card. It's got fitness DMR. It's got access to care. So it's got 12 one-way trips and transportation. So it's got some really rich benefits. It's really designed to help that LIS member. They do not have to have LIS to take the plan. They do not have to have LIS to take the plan. But if you're asking me, Angela, who would you sell this plan to? Who does it fit the best? That's really who it's designed in mind. Other members can buy it if they like the way the benefits stack up. Okay, they can totally buy it. However, that being said, there is a medical deductible or a Part D deductible, excuse me, on some of the tiers. So they might have to pay that. So it really is designed to protect that lower income member. A big thing we talked about earlier was benefits checkup. So if you're trying to identify those members, find other programs, figure out if they have LIS, we'll set something up and make sure we show you guys how to do that, because it's a tool that's really designed for you guys to help your members. So really excited about this plan. It's got some pretty huge enhancements, like we do on the other plans. You got the dental WYSIWYG. Remember, what you see is what you get. No smoke and mirrors. They can just use it. Eyewear, hearing aids, some larger allowances. And again, if they use our vendors, they don't have to. But if they do use an in-network dentist, iMed, they can do those allowances on site, so they're not waiting for reimbursement.
Did that switch? It did not. Nice. So we talked about the fitness DMR, and it really came about when they rolled out this Smart Fit plan. So this plan is in select markets. This is where we were getting at with identifying some of the needs of your clients. fitting them into the right plan. This could be healthier lifestyle, high activity utilization, low prescription utilization. I mean, maybe a generic or a maintenance prescription, right? They're getting the same amazing Aetna Medicare Advantage plan with all the details, but they're also getting higher supplemental benefits. So they can actively use a lot more of that to fit their lifestyle, right? Zero premium, silver sneakers. I mean, it's another opportunity to sell more silver sneakers information. They're doing a ton of things with silver sneakers, and quite frankly, I don't think any of us talk enough about it. I mean, they're aging as through technology as everybody else. But this fitness reimbursement is up to $1,200 a year.
What can you use? Fishing poles. Okay, no, yoga mats, all kinds of stuff. This plan is really designed for a more active member. If you have someone, and we're not screening people based on their health. We don't have those types of plans. But you have to do a needs assessment and figure out what people need. If you have someone who's getting a plan because they need to have a plan just in case, and they're very active, this is something that they can use for a lot of those tools. So $1,200 in fitness reimbursement. You're going to see really robust, lower tier prescription. You will see it's not as robust on the higher tiers because, again, this is not for the member who's a super high utilizer with a lot of chronic conditions. They can take the plan. We're not telling them they can't. It's not designed for them. And a lot, your preventative, your lab, stuff like that's all zero. Again, get the preventative care, stay healthy, stay active. So they have a lot more in the allowances than some of the other plans. That's everything I just said.
Mm-hmm. Sorry, I think I have a line here.
You're good. Except one more.
Working on it.
Or it's
There we
broken.
go.
All right, go
There
for
we
it.
go. All right, so a lot of the plans operate a little bit differently, and this will be easier when you see, our broker user guide or the information in front of you. But what is total choice dental? How does this work?
And
What
be
is
clear-
DMR?
And we didn't cover all the plans in Michigan, you guys, because again, I promised we wouldn't. In different areas, we do have some other things. When you get the summaries, you can see more in detail. So just keep in mind, they're all county. Everyone knows that with Medicare Advantage, they're county based. You guys know that already. So they're county based. So you might have in the UP, you're going to have different stuff than you're going to have in Grand Rapids, different than you're going to have in Detroit, right? All right, go for dental.
Okay, well, some of this can be a little confusing, so I'm going to try to do my best to simplify. First, raise your hand if you want to tell me what DMR stands for. I know another acronym in our business, DMR. Anybody? What's that? Direct member reimbursement. So this is no longer, I'm sorry, I missed it. This isn't dental reimbursement. It's not just dental. We have reimbursement on that fitness as well. Direct member reimbursement. These plans operate where you can see any ADA dentist. And I'll break that down. So we do have a total PPO network, right? We do have a dental network nationwide. A lot of our members are actually already in that network. That saves them money out of their pocket up front. We're getting the bills. They may be getting discounts with an in-network provider. That allowance is 100% at an in-network provider.
Did not change that. So same as it is now. If they're in network, they can bill us. Out of network they don't have to. But in network, they're going to get a discount. They're going to get the discounted contracted rate and they can bill us. They don't lose benefits. It helps their dollars go further. So we have a national network. The providers that are showing online, they should bill us. But you're going to see members be able to get more for their money, especially with implants. We cover implants, we cover dentures, those bigger ticket item veneers. We cover those things. This is a great way to help them spread those dollars and go further. And we don't limit it. There's no like you can only have this many of this, whatever. It's an allowance. If you need 2 or 3 implants or you need 4 crowns, God, that sounds fun. Everyone's favorite, dental game, any of those things. Maybe you have 4 fillings or it doesn't matter. This is an allowance. It's covered as long as it's not teeth whitening or administrative codes at an ADA dentist. It's covered up until they use their dollars. But if they go in network, they'll be able to stretch them further. Hey, if anybody's getting ready to leave, if you want credit, I need you to sign the sign-in sheet on our table and give us your NPN, or I will see you for the same bad movie in Troy or Livonia in a few weeks.
You good there?
Yeah. Go ahead and sign in. It's on our sheet. Otherwise, I see you for the same bad movie. I don't have new jokes, so it won't be any funnier. So sign in.
Did we have any questions on the DMR dental or direct member reimbursement? Did you want to move forward?
touch on it. So dental, 100% in network on most of our plans. Again, there are some plans that are strictly DMR, and the DSNP is network only. So let's talk about everything not DSNP and not MA only. Okay, is that fine? So the MAPD plans, not DSNP. Everyone with me? Say yes. I'll stand here all day. Okay. It's 100% if they go to an in-network provider, dollar for dollar dental. The services are the same, but if they go to an out-of-network provider, it's going to be 80/20. There's still no waiting periods. There's no exclusions. There's none of that. Same things are covered. Their dollars will not go as far. So keep that in mind. Okay. We don't care if they go in or out. We want them to do what's best for them, but their dollars will go further. They can get more if they go in network. You can just go to our provider finder at Medicare.com, click dental. It's current. It's updated 6 days a week. You can find a provider. If you have trouble, let your broker manager know.
2024.
Not on all plans. Some plans it depends. So we have both. So some plans are 100 and some are 180, or depends on the plan and which market. So it's not like all value, all premier. But it is go in or out of network, and network bills us discounted rate. Out of network, it's the same dollars. It just is how they're allocated. The process is the same. And you can submit the claims online. Do not mail. You can fax them if you want to.
Your members can submit the claims online too. Can really coach them through that.
Guys paid receipt. It needs to show what they had done. The provider, not the office. We have to have the dental provider. This is important. I can't tell you how many we get that get stuck because it's like Smith Insurance or Smith Dental, ABC. We don't know who that is. We have no idea who did the service. We can't verify that they're an ADA approved dentist because we don't know who they saw. So it has to show who they saw, what they had done, and that they paid it. It has to be submitted within a year. Go ahead. The MA only.
Yep.
The PPO, the MAPD plans, it's total choice now. Good question. Good on dental? Makes sense? Super easy. WYSIWYG, what you see is what you get. Super simple. Yeah. In or out of network, doesn't matter. You pay more if you go out. That's okay, but they can still go.
Well, we don't always know.
And then if you're really bored and you like math better than I do, there's some breakdowns that say, oh, okay, if you had this allowance in network versus out of network, what does that look like just for if you need a visual? This talks about IMED. Again, they don't have to go to IMED. Go to AetnaMedicareVision.com to find a provider, not Aetna MedicareVision.com, not Aetna Medicare, because you're not looking for a specialist, you're looking for IMED, right? If they go to an IMED provider, they'll get a discount. They'll use their allowance on site. So especially members who don't have $400 for new glasses, they'll give them a discount, and then they'll use their allowance right there. They'll pay the difference. Okay. Hearing benefit, Nation's Hearing. They have to call Nation's Hearing. If your sister Susie went there and you know they're in network, don't care. You still have to call. They will coordinate your appointment. If they do it any other way, they will have no coverage. There's no workaround. There's no reimbursement. This is one of the only benefits that we kind of have locked in where there's not a lot of flexibility. So please make sure you own this number. Keep it handy. Again, we'll send this to, I'll make sure, Sunny, you have the updated deck. You can cascade for me. Okay, this number you call, tell them where you're at. They'll tell you who's in network. They'll help you set your appointment, and they'll make sure the benefit is administered properly. Otherwise, your allowance won't work. There is no workaround. It has to be Nation's Hearing.
Did you have a question?
It's in all the, we'll send it out. Yeah, it's in our broker user guide, which we would have given out last year and we'll send once they're finalized for this year too. And it's on the magnet we talked about for members so that you have the emails. Well, not the internal ones are just for you guys. Obviously, you guys work with your members, we'll help you. Websites, phone numbers, all of that is in the broker user guide. And it also, when you'll see it, we'll do it. We had to break it because it was so big last year and we added so many plans. So it's state specific and it's still being proofed, but it's just for you guys. And the back, there's a resource guide. It's the same as it is this year. And it says who to call, what to call, where, what do they do? And for the extras, it gives you like the stuff right here. It gives you a breakdown like, hey, this is what they'll do and how often. And here's the website. Yeah. So absolutely. So fun facts, my entire sales team was brokers first. So we lived the same nightmares that you guys do. And I was like, I want all of this easy. I need it in one place. I have 17 carriers. My brain is bleeding. It's too much information. So we give you a guide every year that keeps it all in one place for you. Absolutely. So you'll get that. And it actually tells you, like, based on the plan ID for your state, which goes with what. Keeps super simple. Because everyone's like, oh, how about that Aetna value plan? I'm like, and they're like, oh, in this state. I'm like, I need a county because we have 4 value plans in Michigan, right? Like, and they're all just slightly different. So yeah, absolutely. You'll get that probably end of September, sometime mid to end September. We'll get those out to you. I will get you guys a digital copy, and as soon as we have them in print, we'll get them over to Sunny. No problem. Good question. Thank you. All right. This is just more on the, again, we have 2 cards, right? Medical wrap, medical services, flex card, everything else, right? Easy? Okay, cool. All right, same thing. It's $100 or $200 medical wrap, depending on the plan. Does not roll over. Use it or lose it. This is what the nation's card looks like for people who are using the other benefits, not the medical wrap. So other things. Then there's a list on the next page that tells you a little bit more about what you can use it for. So everyone memorize that real quick. There's a test in 5 minutes. No, it's fine. Go ahead. And that's just for our decent plan. Dan can't make it work. Prescription plans. We still have 3. The premiums are going up. Nobody's surprised with the stuff going on with CMS. I'm sorry, they are going up. We'll still have 3. I don't have the formularies or the final numbers on pricing because, again, we shared that NAMBA, the Part D, came back, which all the Part D stuff has to be reworked for pricing after that. I'm guessing we'll have it in the next few weeks, and we'll share it. But there'll still be 3 plans available in the market, so no big aversion, no major changes. Everything I've heard so far, it's initial, is pretty positive, except for the premium increases, which I know are a little bit of a pain point, but that's going to be across the board, I think, with the changes because of the IRA last year. Okay.
Maybe not.
And okay, there's another slide, but you can't see it because Dan's going to go have to figure out what's going on with the computer back there. All right, so in your brain, you should see a slide that has all 3 Part Ds next to each other and all this really small font that you can't read, but you'll see when I send it to you and it gives you the breakdown. There you go. You can read that, right? Ready for the test? You got it? Test in 5 minutes. You're ready? Okay, cool. I don't think
just average, by the way.
it's just the national average.
Not going to be accurate.
This is the national average. So we don't have the finals because of the NAMBA. So this is just the breakdown of the plans. The structure hasn't really changed. You will see that they are different formularies. So this is the key thing. All 3 of them have different formularies. So when you get ready to order supplies, please, please, please order the right formulary. It'll tell you when you order your sales kits which formulary goes with what. Like, if it'll tell you. So make sure you get the right one because P1, P2, P1, P3, P5. Nobody knows what that means. I work here and I don't really know why they name them those things. They couldn't just be like silver, gold, and bronze. That'd be easier, right? No. So when you order them, they are different. So make sure you pull those because it'll give you different information. Okay. And of course, the online tool will be updated. These are our vendors. You can see there's no major changes to our provider network for our pharmacy. So what you know now, as of right now, I don't know of any changes. Not saying there won't be any, but as of right now, I've got nothing saying the network has changed on the providers for Part D. All right. Complete your, what's next? Yes. Nope.
No.
It won't change. So question on the low cost, the reason we did that. So when that happened, it was 3 years ago. CMS, we know that it's going 2025. We all know the story, right? IRA was coming. I can bore you, but let's not. Grab me for a beer and I'll tell you all about it. So originally it was slated, they said they should knock commissions off completely. Other choice is to member aversion. So let's say 80,000 members, because I don't know the number off my head anymore. We can degrade the plan. Your members are going to leave anyways. Or we can pay you going backwards, not forwards, and keep your members stable. It's a no-brainer. So that's why that happened. We knew that the changes were coming this year and then again next. The carriers, we know. So in order to keep your members stable and safe and continue to let you help you retain, that's why we did what we did. That will not change. And I'm sorry for that. But it's continue to pay commissions going forward or member aversion. Remember how I said my mom will push me in front of a moving bus to protect my kids? I kind of feel that way about our members. Please don't take offense by that. Our job is to protect your members. So that's why it's that way. And I've been an agent, I get it. But if it makes sense, sell them the plan that makes sense. And then the other 2 plans, fully commissionable, same, nothing's changed. No problem. Good question. All right. These are your next steps. Make sure you're ready to sell. Being licensed is not ready to sell. If you're licensed in a state, that doesn't mean you're appointed. please check on Producer World or Inside Think Agent and make sure you're showing. If you add a state, please talk to Sunny and he will make sure you're set up with us if you have questions. Because if you don't check and you're like, well, I got licensed in Texas, cool. But if you didn't tell us that and ask for appointment, we didn't tell Texas you want appointed, you're never getting paid and you're going to get a hate mail if you sell a policy. If you do it more than 3 times, we'll terminate your contract and turn you into the Department of Insurance. Sounds fun. No? No. Simple. I'm just joking, guys. No, we really have to. We have to. That's a legal thing. So just check. If you go on Producer World, you can go to like a map and click your state. It'll show you if you're ready to sell. Okay. If you're not ready to sell, what do you do? Just call broker services. Say, hey, this is my name. What am I missing? It's usually like a box you didn't click, or you got a license renewal in August. Mine's in September, which is super fun, and they don't have it loaded yet. Or maybe you're an LLC to yourself and you didn't send us the license for your agency. That sounds really stupid because we have you. We still need your agency information, right? So little things, just check online. It's updated usually within 48 hours. So just make sure you check it so you get paid. Okay. I am a pretty bold lady. I know you're surprised. So, and I can fix most things. I'm sending it. I'm pretty, I know where the body, I've worked here a long time. I know where the bodies are buried. There's about 3 or 4 things I cannot fix or impact. If you are not appointed and make a sale, I can't fix that. That's because that is a legal thing with CMS. So please check that, please, for me. And then review the producer guide if you have questions. Download the presentation and video starting on October 1st. You'll have the presentation. So compliance is a pain. We all know it. We all live it. We do a recording. Some of you already know that every year of a sales presentation video. It covers the compliance portion of your presentation. So all that stuff about how Medicare A, B, and C work and why we're not Medicare and all those things that no matter how good you are, and if you talk as fast as me, it'll take you 45 minutes to do, right? We cover in about 10 minutes. Play it, note in your file that you played it. You've kind of cut, see, it's a CYA thing. It's protecting you. We do it for you. I mean, we want to protect our members, but you guys are our clients. We're brokered. We're sold through brokers. We want to make sure you guys have the tools to protect your business. And I didn't say they understand everything that they heard. But then it's not like, oh, they started talking to me about their dog who's climbing up on my lap at the appointment or brought me a cup of coffee and we squirrel and we didn't cover something. It's covered in that video. It's a great time to look up their drugs and their doctors. So that'll be available starting October 1st for you guys, or sooner if it gets approved faster. And then all of that. Think Agent is our enrollment tool. There's a lot of materials there. You can check LIS, you can check Medicaid status, A and B dates, all those things. If you need help, we do those trainings regularly. And then, Producer World. If you need help with Producer World benefits checkup, we offer trainings constantly. Sunny, if there's something that you need for your team, you let me know. I'll set it up. We can do it just for you guys too. So, questions on any of that?
Last but not least.
Ready for the test? Come on.
All right, what's next? So all that.
All of that.
But you can start ordering your kits. Does anybody know the date? I know I talked to a couple people last night. August 28th. Now, that's FIFO, first in, first out. So if you're done with your certification, get in there on the 28th and order your first set of kits, okay?
So if you're ready to sell, you can get in. If you are a front runner, thank you. You get about 3 days extra because first in, first out. Front runners get in first. August.
8/28. August
Yes.
28th.
You can start putting in pre-orders because those are print on demand, first in, first out. Front runners, you can get in 3 days sooner. And then everyone else can get in, but get them ordered. If you order them, it takes about 7 days. Once they're all in production, the first set usually takes longer because we're in the CMS approval process now. So we'll get them to you as fast as we can. But if you don't submit your order until like September 15th, you're going to the back of the line. So, and our team does not, I do have a big truck. I was going to joke, but I actually really do drive a big truck. But we don't, take boxes of kits around. We might have a handful, but if you need a supply, you want to get them in time.
We will be scheduling coffee and kits, happy hours, product rollouts. Look up our training sites. If we're in the area, you need to pick up kits or you want to stop by, have a coffee, talk about a plan benefit, check that out. Get with your broker manager, whether it's myself, Renita, Ryan Turkoleski. They'll all be back. So we're excited to go. Any other questions? What's that? Other slide?
There's one more.
Oh, I didn't know that. You got it?
Yep.
Okay, so I thought we were done. I didn't even know there was another slide. So we went over all this WYSIWYG, guys. This is easy. We're making it easy. It's not convoluted. Don't get too, you don't have to compare every single plan out there. compare your benefit, your member, your client, figure out about them first, do more of that. We have the no copay stacking. You guys have heard that a lot. It adds a lot of savings in a plan year. Please talk about it. It's not in a benefit summary. It's an REOC. It's not in a benefit summary. You can't see those savings. If you talk about it, you're gonna get questions. Eyes are gonna pop up. I promise. Seamless national network medical wrap cards are new. Study those. DSNP flex card we went over is a little bit different than the medical wrap. It's a little unique. The fitness DMR, I know we rushed through a lot of that, but it's new. It's unique. It's going to take you talking about this to really see this plan like grow.
And the
We
nice
want to
thing
partner
is,
with you on these plans. These
the
are
nice
going to
thing is you go to someone's house and you're like, okay, I see that they're a runner or they're doing something. They're going to tell you about those things. You'd be like, hey, by the way. So if you're doing in your office appointments, it's a little bit harder sometimes to know that, hey, they're a big fisherman because apparently it's on Dan's brain today. Things like that. But you can come, like, they'll tell
my
you those
favorite
things.
benefit.
You'll see pictures like, hey, they were at Yellowstone, right? You'll see those things. So it's kind of a nice thing that you can probably identify what they use it for. Just make sure to share it because it's one of those use it or lose it benefits that they'll probably like OTC that if you don't remind them, there's a good chance they'll forget about.
Yep. You guys were here. There's a lot of information. You're going to have questions. Reach out to us. That's what we're here for. And you've got a great team. We're expanding. We're here to partner with you.
Yes, we have expanded our sales team and we're still hiring. So
That's right.
yes, we will keep bringing on more people to support you guys.
All right. Well, thank you. Thank you so much.
Any questions? You guys good? Ready? Happy overtime? Okay. Thank you. Thanks for sticking with us. Please sign my sheet in the back so you get credit. Otherwise, same bad movie. We'll play on a rerun every day for the next 4 weeks. So
I'll just say goodbye as most of you are walking out the door. Thanks for coming, everyone. Hope you had a good time. Happy AEP. It's coming up. We're